So they might get a fatality
Hello, everyone. Can you hear me?
Hello, yes, I can hear you.
Yes, okay, great. We're just gonna wait a couple more minutes as we let some more board members join the webinar, and then we'll get started. So we'll give the co-chairs a heads up when we're ready to roll. Just a couple more minutes. Thank you.
Thank you.
It is the first day of March Madness today, so that might be contributing to some absent board members. I don't know.
Okay, welcome everyone. Thank you for your patience. We are ready to get started. So I will hand it over to Co-Chair Senator Wilson and Co-Chair Dr. Diane Levy.
Well, thanks so much. I'll start and then Dr. Levy, I'm going to pass it over to you. But really want to welcome everybody today and thank you all for being here. And I'm humbled to be here. This is our first meeting as new co-chairs of DCYF Oversight Board. So really happy to take that on. And end of a fast session. And so I know I just was checking in with Senator Warnick. I've had a couple days to do a little bit of breathing and ready to kind of launch back in and to really hear a little bit about what's happened over the last session, but also thoughts from the board about how we move forward and what we need to do given some changes that are coming to staff and such, which we'll talk about as we move forward. So just for myself, will say I've been part of the work of this agency before it was ever DCYF. So from the time I started with early learning, it was in the Community Trade and Economic Development. Then it moved to the Department of Early Learning. Now we're in the Department of Children, Youth, and Families. And so just happy to be part of the work that's going on across the state for kids and families. So thanks for being here this afternoon. And Dr. Levy, I will pass it over to you.
Thank you, Senator Wilson. Yeah, this is our first board meeting officially as co-chairs, so bear with us as we work our way through this. But I just wanted to second that I'm very excited for the next couple of years and where I think we can go. We do have some changes coming that we're going to be talking about shortly. And I think it's going to be potentially a good time for us to sort of refocus our group a bit and think about where we want to head. So I'm looking forward to it. I hope that we can continue to do the good work of looking after the state's children and youth. And now I will go to, I think it's Krista who's going to call the roll.
Yes, thank you. Apologies, we've got some feedback in the room. So for board members, once I call your name, if you can go ahead and unmute and let us know if you are present. Katie Byron. Justice Bobby Bridge.
Present.
Thank you. Ben DeHaan.
Present.
Thank you. Representative Tom Dent. Sydney Forrester.
He won't be able to join us today.
Danielle Johnson.
Present.
Thank you. Ruth Kagi.
Here in person.
I'm very glad to see you. Co-chair Dr. Diane Levy.
Present.
Thank you. Lois Martin.
Present.
Thank you, Lois. Shronda Slivanoff. Representative Tana Sen. Senator Judy Warnick.
I'm present.
Thank you. Co-chair Senator Claire Wilson.
Present.
Thank you. And so the board knows our Assistant Attorney General, Kristen Lamson, is also in the room and present. With that, we have 8 members present, which gives us quorum to continue the meeting.
Thank you.
Back to the co-chairs. I think Dr. Levy to discuss the minutes from the last meeting.
Yes, thank you. We should have all had a chance to look at the minutes that came out electronically yesterday. So does anybody have any change or additions to the minutes? I don't hear any or see any hands. So
I think
with that said, I think we can move to pass the minutes and move on to the next agenda item.
I'll
Do we
move
need
to
a
approve
motion?
if you would like a motion. I will move to approve.
right, didn't realize we needed a motion, but that sounds good. Anybody want to second the motion?
Second.
That was Ruth.
Okay, all in favor?
Aye.
Aye.
Any opposed? Okay, hearing no opposed, then we pass the minutes.
Phew, first order business, done. There we go. So we're moving on. And really, this is an important piece of information. As we said, there's, change happening. And as you may or may not have heard, unfortunately, we're going to be losing Krista in her role as executive director for the Oversight Board. And her last day will be April 30th, 2024. And so we've been in conversation, and she and staff have been in conversation related to what it might look like to get ready for the recruitment of and the hiring of a new board executive director. And so Krista would love to have you step in and share what you know and next steps in the process, and kind of what you know from the governor's office and kind of what that process is going to look like. And then we can have some conversation from there. So passing it over to you, and want to say just ahead of time, thanks for everything. And we will miss having you kind of at the reins and making sure things are in order for all of us. So with that. You're going to need to unmute yourself.
Can everyone hear me now?
Sorry, we're trying to figure out.
You've got a really bad echo, Krista.
We do.
Do you have more than one computer on in that room?
We do, and we've been working through the AV system. Can everyone hear me now? Yes. Okay. I think
That seems
dealt with it.
better.
Thank you,
Yeah.
Nicholas, the problem solver at all times. Apologies for the technology. We're in a room today that doesn't have the full setup that we expected, so we've been trying to troubleshoot all morning. But yes, thank you for handing it over to me. I am leaving, and I did get a chance to talk to the governor's office yesterday about the recruitment process. They are good to go with posting the position as soon as the board is ready. I've talked also, we're fortunate to have Patrick Dowd in the room as well. He was very deeply involved in my hiring process 5 years ago. And Patrick's here as a resource to help answer any questions, or offline as well, about what those next steps are. The statute does state that the board has the authority by majority vote to select the executive director to work on behalf at the pleasure of the board. Previously, all that work, including reviewing applications, getting to finalists, and the interview process, I think it was three different interviews throughout the entire process, was conducted by board members. Doesn't necessarily have to look exactly like that this year, but what I would suggest to the board today is to create a hiring subcommittee. And we would need to do so with a motion and a vote to bring together a few board members who are interested in being part of that process and can work more offline to get that underway. And that would include getting in contact with the governor's office, HR system, and working with staff on our end to make sure that all the logistical pieces, including posting the position as well as getting applications in, could potentially be part of that process. I do know that by creating the subcommittee today, once we understand more what that process would look like, we likely would have to have another special meeting with the board to delegate specific authority to that subcommittee of what that subcommittee would be responsible for in that process. So there's clarity in that regard. So this today would really be a suggestion just to create that subcommittee to get a few people together. And we can start those next steps and then come back and delegate that authority. And I'm looking over at our Assistant Attorney General if there's anything to add.
Just a couple of things. Good. I guess it's afternoon by now. Sorry, I've been in meetings all morning. I just wanted to share a couple of things. One, there is an assigned Assistant Attorney General from our labor and personnel division that's available to support the subcommittee also with any questions about process or anything that comes up. So I will be putting Krista in touch with that person. I'm also available to assist with any meeting issues. There are certain portions of hiring processes that can happen in executive session during open meetings. And those are the kinds of things that I would be working with the labor personnel AAG to help come up with a package of recommendations on how to continue with the process. I think one of the things that other attorney and I talked about is a first step, and one possible delegation of authority for you to consider today is that subcommittee come up with a recommendation of what the planned process should be. There's a number of choices that need to be made about whether you want to use a contractor to do some of the outreach, about whether you want to have the committee actually review all the applications and just present the full board with a couple of options that they've already whittled through, or whether the full board wants to look at every application that comes through. So there's some policy choices there, and it might make sense as a first delegation of authority for a subcommittee to meet internally with the governor's office, with Krista, and with the AAG on process options, and bring back a recommended planned process for the board to then authorize the full scope of the committee with that information in hand. And then I just also want to flag, and maybe you're going to cover this, of whether there's a second question about making a motion for an interim to happen today. And I don't know if you've talked about that or whether that's something that we need to talk about offline.
That's probably an offline conversation based on some information yesterday.
Okay.
So yeah, that might be.
So that was my only suggestion of giving the subcommittee an initial task today, potentially of meeting with all of the resources available, the governor's office, the AAG's office, and current staff to recommend a process involving the committee, and that would help set the delegation of authorities for the subcommittee going forward.
Thank you. And so with that, I would just recommend that that's exactly what the board does for this part of the agenda, is to make a motion to create the subcommittee, and then also to make a separate motion to delegate that specific authority on what the next steps in the process, or what the process would look like for the hiring and recruitment, to then be presented to the board to approve that at a future date. Okay.
Well, I'd like-
Okay, in agreement with, go ahead, somebody is talking, I'm sorry, who's that?
Go ahead.
Okay, in agreement with the subcommittee, what we would probably need next then is to call for a motion to create the subcommittee to hire the next executive director. And then after we have the motion made and seconded, I believe we can have discussion on it, correct? Okay, so does anybody wish to make that motion? I see Bobby.
Yeah, this is
Bridge.
Bobby. I would make the motion, but the subcommittee is not going to do the hiring. I think the board needs to do the hiring, and the subcommittee would
Correct.
be coming up together with the assistants. We're going to get to that, but the assistants of the Attorney General's office, that we would come up with a proposal, review applicants, come up with a proposal for a process, review applicants for the position, and then make recommendations to the board about interviews, period. I think.
Great clarification. Thank you. Yes. Yes, you're absolutely right. This subcommittee is not meant to be hiring. The board hires, but would make recommendations to the board regarding the new executive director position. And so if you are, so it sounds like, Bobby, you're willing to make that motion?
I just did.
Okay.
So I would move that.
Oh, this Hoyle's rules. The physician on the team does not know about this stuff. So you can sort of help me where I need it. Okay. Anybody want to second the motion?
Happy to second the motion.
Okay. Now I believe we have discussion, correct? And there are some people on the board. I just wanted to mention that were present last time we elected an executive director. So if people have some input and would like to provide that, this would be an excellent time.
So I would, this is Ben. I was part of the process last time, and as I recall, the stickiest pieces of it were around the private nature of some of the conversations that needed to happen, and whether or not we were using the executive functions of being able to talk openly, separate from the meeting rule, open meeting rules. So I'm hoping that when we get this proposal, that it'll be clear what part is private versus what part is public, because it is difficult to handle when there's a lot of people watching that you don't really know, and I think it makes applicants uncomfortable. So I'm looking forward to having that part of it made more clear.
Yeah, and that's something that both myself and the Assistant Attorney General that is focused on human resources and labor and personnel issues, we would be working together to map out the process and understand where the OPMA applies or doesn't, and what tools we have within that to make that process be comfortable.
I also am just assuming that as we're working this forward and creating the process to then present to the board about how things would happen, that could be done virtually, just like we're doing this, so that it would, I think, hope and help, I think, with people trying to decide whether they may be able to consider whatever time commitment might happen. Is that how we might plan forward, as opposed to in-person meetings? Is that something we can consider virtually? Just checking in on just process for us about what might look and what might work for folks.
Yeah, since the subcommittee, the recommendation is at max 3 to 4 additional, or 3 to 4 board members be on the subcommittee, and that would be below quorum. So it wouldn't have any requirements, the OPMA, to have an in-person location as well as a virtual location. It could happen all virtually. And it wouldn't be on a public setting either, because it would be below quorum.
That's correct. And I would just like to clarify, because I think it will be helpful, is that the subcommittee today, it's possible, or what we would anticipate is that there would need to be a future special meeting or regular meeting where that subcommittee would present, here is the process that we're recommending to go forward. At that time, you could be delegating additional authority to the same subcommittee, or you actually would have options to change the subcommittee with the process that you end up adopting at that time. So just want to make clear that this first step in the motion today is for a subcommittee that would help recommend the process. And then you'd have opportunities to continue that subcommittee with new duties, or create a different subcommittee to go forward with the actual adopted process. So just to make that clear, that there is an anticipation that there would need to be a second board action to adopt the process and give that process and the subcommittee's role that authority.
And this is Bobby, that's the intent of the maker of the motion. And to add, I think one phrase you didn't put in, but that this motion also intends that there be consultation with the AG's office as we make these, as we prepare the recommendations that are to be brought back to the board with respect to the process. And as Ben noted, I think we didn't bring in the AG soon enough so that we were prepared. We brought them in at points in time, but it was only when we got to the snafus or we got to the concerns that we did it. And the idea now is that the development of the process itself is going to include the AGs. So we will probably be more detailed about that.
Lois, did you have a question? I saw your hand up briefly. Or a comment.
But thank you, I did, but you answered, or Krista answered it about the quorum piece and public meetings. But I do want to know if you and Senator Wilson just have started or have thought about what the timeline would be. Have you considered that, or are you leaving that up to the subcommittee to put in the timeline between, how long the process is going to take?
Well, what I would say is that it's a work in process, Lois, because part of this has been conversations that Krista's had with understanding the process going forward. It seems there are ongoing conversations. So for example, we weren't sure exactly when they would post the position, which is kind of where a nice starting point. So I think I suspect that that's going to be the work of the subcommittee to some extent, but certainly we don't want to delay getting started on this because it's important for our board. Senator Wilson, would you concur?
Yeah, and I also think we have to work within the guise of our HR department, and, you know, all of that has to kind of fit as we think about that. And I think there was mention of an interim, and again, part of that is part of being in the governor's office. Part of it is the conversation with the systems within there and how we all fit together. So don't have dates, but understand, I know for me, from a board perspective, we'd like to have someone in there as soon as we can. We also have empty positions, and we'd like to think about that as well. But I also think it's time for us, I think as Diane said, to think back to and do some reflecting. We're at a 5-year point too. So it's a really good time to make sure we have a process in place, make sure whoever we have come in is, you know, the board has been part of those conversations. And as Bobby, as you said, having AG at the very beginning, not at the end, will set us up. But actual dates, you know, don't have that. And I think that's, as we move forward, we'll figure that out. But I think the timeline, the committee will be responsible for helping us plot and then bring back to the board. That would be my assumption. Sooner rather than later would be my hope.
I thank you both.
So maybe it would help me, I think, to hear, and Krista, I don't know if you could do this. Could you read the motion again and then we can vote?
I did not.
Do you want me to do that?
Yes.
I'm gonna wing it, so if anybody needs to correct me, say there's a motion and it's been seconded. The motion is to set a subcommittee for the hiring process of the executive director under Article 3, Section 1. That's the bylaws that allows you to set up subcommittees. You don't need to put that in the motion. And that subcommittee will be responsible for consulting with the AAG's office, the governor's office, and OFM HR to bring back a recommended process to hire the executive director under 43-216-015-17. And at that time, we anticipate the subcommittee would bring a process recommendation for the board to approve.
Including timeline.
Including a timeline. And I don't think we talked about it, but the motion is to have a subcommittee with 3 to 4 members board.
Thank you. I'm glad you read that. That was very helpful. So let's go ahead and Senator Wilson, okay with moving forward in a vote? Okay, let's go ahead and vote. All those in favor of said motion indicate by saying aye, please.
Aye.
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 Are there any opposed? Okay, hearing no opposed, the motion is passed. Oops, now the next part is to get the volunteers for said subcommittee. So, are there any board members that are willing at this point to volunteer to sit on the subcommittee?
I would, I don't know if you could see me.
Oh,
I see
that's,
Bobby's got her
like-
hand up. Yep.
okay, so Ruth and Bobby, I
Yes.
see.
Who did I
I'm willing
hear? I
to-
heard a voice.
You may have heard me. I was just verifying that Ruth was heard, that she volunteered to join.
I'm willing to also be on the subcommittee.
Okay.
So that's 3. Anybody else?
Happy to step in, but I don't want to take a space of someone else who may be interested. So I will be on the other list if we need or can add someone. Just want to put that out there.
You know, the one thing we didn't talk about is the time commitment. I know we're just kind of making, well, I would be playing reference in light of everything. But I know we are in the process of figuring this all out, but is there an estimate of the time commitment? How often the subcommittee will meet? That
If I can respond to that, my guesstimate, this is the guesstimate, depends on how many questions the subcommittee has, but a lot of that work can be done with staff and AEGs, and we can probably anticipate at least 2 meetings, one to talk about options and have your questions answered, and then maybe one more meeting to finalize all the choices that the subcommittee wants to recommend. So I would anticipate maybe 2 separate 1-hour meetings with staff and AAGs. And likely there may be some conversations with Krista, with the subcommittee members. But a lot of that work can be done by staff and AAGs in the background. So I think at this stage, to come up with a process recommendation is not a huge time commitment. It's going to be that once you start implementing the process down the road is where the time commitment issues are likely to be more significant or meaningful.
if it's 2 1-hour meetings, and I can volunteer my time.
So I recorded Justice Bobby Bridge, Ruth Kagi, Dr. Diane Levy, and Lois Martin as the subcommittee members, and alternate Senator Wilson as needed.
Is there a need at this point to do anything like identify a chair of the subcommittee?
I think
Or
that would
can we do that?
I think it would be helpful, and your bylaws do say to identify the purpose and identify the chairs and the membership. So you've just identified the membership and the purpose. So you still need to identify the chair. And it's very common, you don't have to do it this way, but it's very common if one of the chairs of the board or commission is actually on the subcommittee that person also play the role of the chair of the subcommittee. That's certainly not required, but just letting you know that is fairly common.
Well, that would probably be me then.
That's you, boss.
I would hate to take this from somebody else if there's somebody that feels really that they would like to do said chair position, but if not, I'm happy to do it. Anybody else?
Do we need to make a formal motion? Because if so, I would love to be able to make a motion to ask that co-chair of the Oversight Board also play the role of chair of the committee, just to make those aligned connections between what's happening systemically, but also just at every level. That would be really helpful, I think. So I would make a motion and ask for a second.
Second.
So we need
Call
to
the
vote on
question.
this. All in favor?
Aye.
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 All opposed? Was there, it's somebody that said nay? No, okay. All right, second motion is carried then, thank you.
All right, I think we're moving on. We're 1 minute behind, so we're doing well. Woo! And we're at a place now where we can listen and not have to maybe think so much. At least for me, which when we're thinking about motions and who does what and who's on first and who's on second. But you know, one of the things that we've talked about in the past, and I think the meeting that I was at the last time, we talked a little bit about what was of interest to members of the board and what was top of mind and what things were coming forward that we were interested in knowing a little bit more about. And one of the things that came up was the issue around the fentanyl crisis and really around high potency synthetic opioids and the whole public health crisis that that's created. And so in response to that, today we brought together some experts in the field that know way more than I do around this particular issue. And I'm going to introduce them and then give them an opportunity to kind of share and give us an opportunity to do some questions and get some answers. And then we'll also, you know, keep moving forward, but we're going to start with this first. And I want to introduce Dr. Vicky Ibarra from DCYF, and she's the Assistant Secretary of Partnership Prevention Services. And then we have Dr. Herbert Duber, who comes from the Department of Health and is a regional medical officer. And then Dr. Lacey Fehrenbach from maternal public health, has a master's in public health and is with Department of Health and Chief of Prevention. And some of these faces are I've seen over the last, especially Lacey, when we think about the pandemic and the work that you've been, you know, we're doing a number of years ago, and now we're moving into another public health crisis. And so really am appreciative of the three of you being here today, and I'm just gonna pass it off. And I think, Vicky, are you gonna kind of start things and then move forward and just give you the stage? And I think if it works for you, if you wanna figure out what works best, asking questions along the way, or whether you'd rather do a piece of a presentation and then have us ask questions, just let us know kind of what works best for you. But thanks for being here today and appreciate the information you're ready to share with us.
Thanks so much, Senator Wilson. Glad to be here. Thanks so much to the Oversight Board for having us. As you said, I'm Vicky Ibarra. I am currently Assistant Secretary for Partnership Prevention and Services, so a bit different role than when I saw you last. I'll start today with just a bit of background that some of you are familiar with, so hopefully it doesn't take too much time. And then I'll pass it off to Dr. Duber and Lacey to share information from their perspective. But we'll start with DCYF and the child welfare system and what we're seeing. Again, I think some of you have seen some of this information. Next slide, please. You can go ahead and move to the next slide. There you go. Thank you. So as you know, in DCYF's child welfare system, we have been dealing for some time with the challenges of fentanyl. Our staff who are working in front-end child welfare have the responsibility of assessing child safety, and this is clearly difficult when a family may be involved in fentanyl use. We have seen at the same time reduction in the number of children entering out-of-home care related to policy changes that have happened. 1227 and the changes that have happened in Plan of Safe Care have driven this change. At the same time, we've seen a significant increase in the number of child fatalities and near fatalities involving fentanyl that we're required to review as a department, those cases that had an open child welfare case within the last 12 months, and they're suggestive of maltreatment. And then at the same time in the community, we've seen a lack of sufficient treatment services available, especially those that allow a child to stay with a parent. So these are the challenges I'll be sharing a bit about with you today. Next slide. Child welfare involved families, we know, have high rates of substance use disorder and low rates of accessing treatment. This data references a 2020 study we did with RDA that looked at data primarily from before the pandemic about child welfare involved families. And at that time, we knew that statewide, only about 39% of child welfare involved caregivers who needed access to treatment were getting access to treatment. So that was 2020, before the recent rise in fentanyl use. RDA did a really nice job with that study. They assessed not only child welfare involved caregivers with children in foster care, but those in front end. They also looked at opioid use disorder. We're working with them to try to get updated data, but we would expect the number of caregivers who need treatment would be even higher today, given the number of families coming into our system. I'm sorry, Senator Wilson, RDA Research and Data Analysis. It's the research unit at DSHS that does integrated data between state agencies and is able to do analysis based on those integrated data. Next slide. Nationally, of course, we know that opioids are a leading cause of fatal poisonings in young children. We've certainly seen that in this state, and I'll defer to Dr. Huber, who's going to share with us poisoning data specific to Washington State, but this is definitely a concern. Next slide. As I said, fentanyl is a driving factor behind an increase in critical incidents that we've seen in Washington State, and this is really an increase over the last 3 years. A critical incident for us, according to statute, occurs when there is a child fatality or near fatality, and when a child or family have been involved in the child welfare system within the last 12 months, and when the fatality or near fatality incident is suggestive of maltreatment. We are required by statute to review all of those cases, and we provide that information publicly. Next slide. So this is the trend on critical incidents that we're required to review. And as you can see, over the last 3 years, this has gone up. These are in-home cases. So these are cases where the child was in the custody of their parents when the critical incidents occurred. We do also monitor out-of-home critical incidents, but those are very few, and we didn't want to muddy the waters here. You've seen that we've had a substantial increase in the last 3 years in the number of critical incidents that we're required to review. And the line that you see that goes up there indicates the number of critical incidents in which fentanyl was involved. So from a low of 2 in 2018 to a high of 33 in 2023. The vast majority of the fentanyl-related incidents in 2023 and in previous years involved children 2 and under. So this is really being driven by, this trend is really being driven by what are accidental ingestions on the part of very young children. Next slide. At the same time, because of policy changes and other reasons, we've seen a substantial decrease in the number of children being placed in out-of-home care long-term. This trend started before the pandemic. It's part of a national trend. It was enabled by the pandemic. The number went down even further with the pandemic, and then also enabled by recent policy changes, 1227. There are a lot of reasons for this trend, but it is consistent with national data and has been in place for quite some time. Next slide. 1227, the Keeping Families Together Act, did contribute to the number of children not being placed, the decrease in the number of children entering care, as it was intended to do. It was intended to safely reduce the number of children entering foster care, as well as reduce racial disproportionality and support safe placement with relatives when a child did need to be placed out of the home. And we have seen a substantial increase in relative placement since last year. Next slide. Both the Keeping Families Together Act and changes that happened at the same time in the Plan of Safe Care, which has to do with newborns, substance-exposed newborns, Those policy changes both happened last year. Plan of 1227 went into effect July 1st. Plan of Safe Care changes went into effect August 1st. Both of those policy changes together have contributed to the decrease in the number of children entering care. Plan of Safe Care, of course, because it's focused mostly on substance-affected newborns, has affected the number of newborns going into care. And we've always had a very large number of newborns going into care in Washington State, whereas Plan of Safe Care, 1227 changes have affected primarily all age groups. But it's really the combination of those two policy changes, both driven by statute, one federal, one state, that have driven this decrease in the number of children entering care. Next slide. We monitor the decrease in the number of children entering care and put data out quarterly on the public 1227 page on the DCYF website. This is from the most recent data that we put out. Entries into care have decreased by this is down to about 20% since the new law went into effect. And you can see here the variation by region. At the beginning, both Region 2 and Region 5 had substantial reductions. Region 5 has moderated since the beginning months of the new policy and is now more in line with the rest of the state. Region 2 continues to remain an outlier here. But the largest reduction in the number of children entering care is still in Region 5 because it's a more urban county. The numbers are actually higher there, but the percentage is more in line with the rest of the state. Next slide. In part because of the number of children, the decrease in the number of children entering care, we're seeing a lot more families at the front end who are not being placed, who are being managed in their communities, who have higher risk factors. And in fact, over the last 3 years, we see an increase in sort of the churn into the child welfare system of higher need families. High need, high risk, but don't meet the imminent physical harm standard, aren't placed, go back into the community, need to be managed in the community, and then are referred back to child welfare, again, for another investigation, but don't meet the standards, so they continue to churn. In fact, in 22, almost 61,000 children were seen in CPS, or families involving 61,000 children were seen in CPS, subject to an investigation or too far. Only 6% resulted in removal. So a small minority of the children we see in front-end CPS are actually removed. But the families, an increasing number of the families where children are not removed do have high risk factors that are being managed in their communities. Next slide. So these are some of the things our caseworkers look for when they're investigating threats to child safety involving fentanyl. They're looking at who's using, where are they using, where do they keep their drugs, who's in the home, is the living situation safe, are there natural supports like families and friends who can participate in the in-home safety plan, are safety services and resources available like childcare and crisis intervention, is treatment available that will allow parents and child to stay together if removal is necessary. Our caseworkers also do engage in harm reduction. So we do have Narcan available and are giving that to families. We do have lock boxes available for drugs and are giving those to families. So they're also engaging in harm reduction. Next slide. We believe strongly that there needs to be more access to SUD treatment, including medication-assisted treatment for child welfare-involved families, for all families who need it, of course, but especially for child welfare-involved families who may be at risk for their children being placed in out-of-home care. Residential treatment models that allow families to remain with their children, especially when we're looking at newborns, are a really important part of the service continuum, and those beds have actually been decreasing in the state, not increasing. We typically in child welfare, historically before 1227, were removing multiple hundreds of infants a year that were impacted by substance abuse. And the number of pregnant and parenting beds in the state is going down. It's only available right now in 6 counties. This last year, there was a treatment provider in Region 6 who closed. But none of those services are available in King or Pierce counties, which is where we see the greatest need. And then, of course, we need improved access, families we work with need improved access to medication-assisted treatment, just as others in their community do. And lastly, I'll just say that the things that we're trying to communicate consistently that our child welfare system needs for responding to fentanyl, of course, access to treatment options, including PPW or PPI treatment, collaboration with the Department of Health, which you'll hear about today for public health information, and then expansion of community-based supports like home visiting and PCAP, and prevention and early intervention opportunities for families to participate in safety planning, for there to be supports available for safety planning services such as that. So that is information for you to update you on where we are in the child welfare system related to fentanyl. I'm happy to answer any questions. Otherwise, I'll turn it over to Dr. Duber and Lacey.
Thank you, Dr. Barra. It looks like there's a question.
Senator Wilson.
Yeah, I just had a quick question about when you talk about families being managed in their communities, what do you mean by that?
I mean that the family is not managed in the child welfare system. So the child welfare system is not actively providing case management services to the family.
Okay, so you're talking case management when you're talking managed. That I'm like in my own mind thinking, what does being managed mean? But you're talking about case management services and supports that families might receive when you're talking about managed in the community.
Yeah, thank you, Senator Wilson, for the opportunity to clarify. Often
Yeah.
those families are not being managed at all and are not accessing services because the services don't exist. So managed is probably a misnomer there.
No, I appreciate that. Thanks for the clarity.
Mm-hmm.
Great, thank you.
We do have a question in the room. Ruth?
Vicki, what are the supports that are available for families? I mean, do they have access to childcare? Do they have, access to other community supports? So to really have other eyes on the child?
It's a great question. Thank you. Our caseworkers do make referrals to community-based resources, whether they're in-home services, therapeutic services that we pay for. When families are in front-end child welfare, they can refer to those services. They certainly can refer to childcare and home visiting, voluntary services. In front-end child welfare, all of the services are voluntary, so families may choose or not to engage. What we hear from our caseworkers is that the service they need the most is substance abuse treatment, and that is what is least available. Many will tell you that, yes, we can refer to therapeutic services, but it's really hard to engage effectively in mental health services if one is still using. So yes, we refer. Yes, there are voluntary services. There is not enough substance use treatment. Dr. Levy?
Hi, Vicki. I was interested in knowing and thinking about it geographically by the regions where you talked about that sort of startling reduction, for example, in Yakima, where I practice, of 41%. Have they been able to correlate whether those regions that have a higher level of kids staying in families are having more critical incidents or near fatalities? Or because if we're doing our job right, the word safety, right? Like you're trying to safely reunify and keep kids in family, then there shouldn't be a correlation. But if there is, I would wonder if that means that we're having that bigger safety concern. I don't know if anybody's looked at that. You're the data person, I know.
Yeah, we have looked at it. Somebody else has that job now, but we have looked at it. Since the numbers are relatively small in critical incidents, it's hard to publish the analysis because we get into cell sizes under 10 that we can't publish, but we have looked at it. And many people want to infer, many people naturally would infer from the data that there is a causal relationship here between the decrease of children entering care and the increase in critical incidents, but that's not what we see. If that were the case, we would see more critical incidents in Yakima and Pierce, and we don't see that. The increase in critical incidents is actually primarily Snohomish and King, so which have seen relatively modest decreases in the number of children entering care. So we do not believe that the increase in critical incidence is causally related to the decrease in the number of children entering care. Rather, we believe it's related to fentanyl.
Thank you.
So with that, I'll turn it over to Dr. Duber.
Great, thank you. I believe we have some slides. All right, thank you, everybody. My name is Herbie Duber. I'm the Regional Medical Officer for Northwest Washington, so the 12 counties in the Northwest of the state. I'm also an emergency physician and a professor at the University of Washington. So it is a pleasure to be here, but unfortunate to be talking about fentanyl. Next slide, please. So we're going to start just by looking at some trends that we're seeing in Washington state. On the left-hand side, the left-hand axis, these are age-adjusted rates per 100,000 for drug overdose in the state. And what you see here is that in 2019, we started to see a significant increase. So that dark blue line are statewide rates, any drug overdose death. It's more than a doubling from 2019 to 2022. And although 2023 isn't on here, we saw a continued increase, if not a slight acceleration. The bottom line, that yellow line, represents youth rates. And you can see that it's much lower. But what I want to call your attention to is that it goes from an age-adjusted rate per 100,000 of 1 in 2019 to 2.7. So an effective increase of 270%. And that's actually significantly more than what we see in the adult population. And so it's important to know that although the numbers are low overall, we see a significant increase in overdose deaths among youth. And this is largely due to the risk associated with fentanyl, as you're all aware. Fentanyl is highly potent, and in many cases, it's adulterated. And frequently, when obtained illicitly, it's unclear what it is adulterated with, whether that's xylazine, whether that is methamphetamine. There are any number of other agents that can be in there that can increase the lethality of an already lethal substance. Next slide, please. So now we go from rates, and we're going to look at some absolute numbers. At the top, you'll see years, and then going across, the first row is any drug, and these are confirmed Washington state overdose deaths among youth, so ages 0 to 17 is what we use here. And you'll see that there's been a remarkable climb, right? So we go from small numbers in 2017 up to 36 confirmed Washington state overdose deaths among those youth in 2023. And the next row demonstrates this is really due to opioids. And then the following row really shows that this is due to fentanyl, right? So 32 of the 36 overdose deaths in Washington state in 2023 were due to fentanyl or synthetic opioids. Pretty remarkable statistics, really. Next slide, please. Now, when we look at youth a little closer, we can look at older youth, adolescents, and then we can look at those who are younger. And unfortunately, we can't break this down much further because, as Dr. Ibarra noted, we get into some small numbers, and so that becomes a bit challenging. I think the most important takeaway here, so on the left-hand side, we see overdose deaths involving any drug, and on the right-hand side, we see overdose deaths involving synthetic opioids or fentanyl. And again, I think that the key takeaway is that fentanyl is driving what we're seeing, right? So the overwhelming majority of those overdose deaths in Washington state are due to synthetic opioids or fentanyl. Now, when we break these down into the older adolescents versus the younger adolescents and children, what we see is that it's overwhelmingly among those older adolescents. And I think that's important to recognize. The risk factors for those older adolescents are very different, and these are intentional ingestions, right? So not accidental, like we may find with the infants or older infants and toddlers, right? These are intentional ingestions. Now, that does not mean they are intentional overdose deaths. And so it's really important to recognize that there's intentional versus accidental ingestion, and then there is intent behind an ingestion, whether that's a suicide attempt or just an accidental overdose. And so this doesn't get into that level, but what we do see is in those younger 14 and under, I will tell you that overwhelmingly those are younger children. So these are less than 3 who probably ingest a substance accidentally. And I think that's really critical to understand. We can talk a little bit more about secondhand exposure and the fact that that is not playing into this later on, if all of you would like to do that. Lacey?
Thanks, Dr. Duber. Next slide, please. So related to the rise that we're seeing here, what Dr. Ibarra shared in terms of increasing critical incidents, there was a bill that passed both the House and Senate this year in Washington State, 6109, and it has a number of actions that it requires DCYF and DOH to do. I'm going to speak to the DOH portion, and one of those is to develop some resources for people in the child welfare system, families, as well as workers and courts, to provide information about the risks of fentanyl exposure to children, and in particular to children who receive child welfare services. That information will be made publicly available on DOH's website, and we will work with DCYF to get it distributed to child welfare professionals as well. And throughout the bill, it is referred to as public health guidance, and something that the court should give great weight to in determining whether removal is necessary to prevent imminent physical harm to the child or children. We plan to approach this through a combination of a literature and resource review, looking at what is out there in the published literature, as well as how other states have approached this, and guidance from national organizations, which we will prepare for a work group. And that work group is required as part of the legislation, who will direct the guidance by giving us feedback and input, so that what we produce is useful to families as well as those who work in the child welfare system. Next slide, please. By statute, that work group must include the Washington Poison Center, DCYF, and the Department of Health. From the health side, we're recommending that we have a public health nurse, a child development specialist, a toxicologist, and a public policy expert. We also recommend including someone with lived experience, and we're thinking a person who has been involved in the child welfare system, who's experienced opioid use disorder and parenting at the same time, as well as a community advocate for the Keeping Families Together Act. We also would include a tribal representative and an urban Indian community representative. And certainly we'll work with DCYF regarding their representation on the work group. We would love to have a child welfare worker if that's possible, but open to others as well. Next slide, please. And we are going to probably approach this guidance looking at known environmental exposure risks, and also stratifying that risk by age group. So we would consider things like risks associated with lactation in infancy, risks associated with accidental ingestion for infants, especially as they start reaching and crawling and walking, and then risks of intentional overdose or accidental overdose for those in the adolescent age of life. And we also will acknowledge what is yet unknown about fentanyl risk, and consider what role and mitigation strategies can be used in assessing imminent physical harm. So strategies around some of the things that Vicki mentioned, like safe storage and harm reduction strategies, as well as parenting supports that are in place within the home, and other wraparound supports for those caregivers or families that help them meet their basic needs, stay in treatment, and look out for their health. We have some current guidance and resources to draw from already developed, including around lactation, eat, sleep, console, secondhand exposure. And we have started looking around at other resources that are available through the American Academy of Pediatrics, as well as other states. We have not found a state that has comprehensive guidance like this, but there are several that have pieces that we can build from here in Washington State. This is, a preliminary plan that we're working towards in regular conversation with DCYF to finalize that plan, outline the work, form the work group, and then actually get started on development and release of this guidance. I don't have slides on this, but I do want to note that increasing access to treatment is one of the main goals within our state opioid plan, and there is a call out specifically around access to treatment for pregnant and parenting people. So that is a big need in our state. And with that, I will pause and just appreciate your time and attention today and the work that you do always, as well as that DCYF does to improve the health and safety of children and families in our state. And with that, Dr. Duber and I can take questions.
Awesome. Okay, there we are. It's like when you're virtual, you're not really sure what's happening in the room, but I just want to appreciate both of you and Vicki as well for being here and sharing the information. And want to also say Patrick is going to be presenting after this, and this really was setting the stage for the deeper dive he'll be doing related to the fatalities and near fatality report findings. So it really is it was a nice frame for us, unfortunately, as we think forward in kind of the next set of information we're going to get. The other thing I'll say is Allison Kritzinger will also be here after we take a break, and we'll dive even more deeply into the legislation that passed. Much of it, again, related to fentanyl and issues that are important to us. 6109, thank you so much, Lacey, was one piece, but there were other things that have come out and other investments that I think you'll be interested in hearing about as well, that may answer some of the wonders or the challenges I think that were presented. So I want to know if anyone's got any questions, and if we don't have questions, that will be a surprise to me. So looking for any hands, or we're not that big of a group of individuals, especially in the room. So Dr. Levy, I see you do have a question.
Always. But what I was interested in knowing is, I guess, a couple of things that come to mind. One is I'm wondering, and maybe this is more for Vicki, but I'm wondering about your caseworkers and their are there concerns about exposure to the caseworkers in the field working with families that may have active substance use disorder? So that, I guess I'll just start with that question.
Thanks, Dr. Levy. I have heard some concerns from caseworkers. I believe we got them the information they needed before legislative session, so that they had what they needed to protect themselves. But I don't know the details of that. I'm happy to gather more information from my colleagues at DCYF and bring you back more information.
I will say that 6109 has a piece in there that talks about access for caseworkers and individuals, again, for their own protection. So there was a piece written into that piece of legislation, in particular in our work with the union around that issue of exposure and their concern. It was amended language that was put into the bill. And so it is part of the final. And Allison, again, might be able to pull that up when she comes and share exactly what that piece is. Just because that's one I do know about.
I just know that in the healthcare field, like in our hospitals, we've had experiences with nurses have gotten exposures when somebody's smoking fentanyl on the wards and then have to actually go to the ER and get checked out. I just wondered whether that had been coming in from the caseworker.
Yeah, I'm sorry. I don't have enough information to speak to that, Dr. Levy.
Thank you.
Other questions individuals might have? Ooh, you're going to get off the hook, both of you. You know that. I will just say I'm so appreciative of the work you are doing. And, you know, it is trying to find that balance, especially as we talk about the work we've done on kinship care and guardianship care and keeping families together and making sure that the work we do doesn't continue to disproportionately impact our Black and brown children, our communities of color, that we're actually addressing the issue at hand. And that is the issue of fentanyl and the public health crisis we have related to that. And that also means we've got to invest and provide supports and services and resources for families that they so badly need. And really want to make sure that we're continuing to do that, because it is around access to resources. And in the context of families is the most, in my mind, the most important thing that we could be doing and should be doing. So Lois, I see you have a hand.
I do, thank you. You know, when you just stated about making sure we have those services for communities of color, it just made me wonder if, do you have any data that's disaggregated by race? Because I would think in our state, it might be a bigger issue for in white communities versus communities of color. So I'm just kind of curious if you have that data, and if not, if that's something that you'll be tracking.
We do have that data. It gets challenging when we get down to children where numbers are small to break it down by race and ethnicity and display that. There's no question in particular that Native Alaskans, American Indians are much more impacted than other groups. But we do see significant disparities by race and ethnicity.
And Lois, in terms of the critical incidents, again, small numbers, we're not able to report out, but just an initial look, we actually found that white families were, white children were more impacted by the rising critical incidents than were children of color.
Right, thank you, Vicki. It'll be interesting to see as this, as you continue to do your well-needed work, how the data shows which communities need the most support. Thank you both. Oh, and definitely thank you, Vicki.
I had one other thought, which is, or concern, I guess, which is when we think about fentanyl and substance use disorders and how they impact children, you know, we're talking about, for example, critical incidents, but there's just such a continuum of how they impact child development, early relational health for the child. I look at Lacey and I know she's been working in this field forever, but I think it's just important to continue to think about this as a broader issue, because I tend to see kids like further down the line who've impacted neglect and for families who have been having substance use disorders, and the importance of that parenting support that you mentioned. I think that's just critical. And I also would put a plug in for working with the pediatric providers and trying to kind of keep them in the loop on what's going on, because they see these children at regular intervals.
Thank you. You are absolutely right. And I think something that I think about every day, the number of people impacted by opioids in our state and the nation, there's hardly anyone at this point untouched by this crisis. And it's hugely impactful, and there will be generational impacts. I also wanted to note for Lois's question, I can put a link to the state's opioid overdose dashboard in the chat, and you can look at demographics like race, ethnicity, geography, and then age. And there are controls built in so that you can, the privacy is protected.
Alrighty, I'm giving that 3-second wait that teachers give to make sure folks don't have any other questions. And again, thank you. And the dashboard information is would be awesome. So always good to be able to manipulate things and kind of see things in your area in particular, especially things you might be interested in to dig a little deeper into. So really appreciative of the three of you being here, and again, the work that you're doing every day. And I'll just say within 6109, there's about 11 buckets of services and supports as we think about the broadest issues around, again, not just fentanyl, but high potency synthetic opioids. And many of those are services and supports, contracted slots for early care and education, really looking at what's happening for prenatal substance use exposure. Also really thinking, Dr. Levy, about what you said is when children age and we see that they've had prenatal substance use disorder, it's like, how are we supporting them throughout that age range and throughout their, whether it's their educational or medical experiences. And so those things are kind of all we've tried to address and begin to address some of those things, and also not just address them, but then fund them, which is the other little nugget that we have to make sure that we do. So really look forward to seeing what the impact is. And as we come back together as a, legislature, how the board can help us determine what our next steps are as far as supports for children and families across the state in this issue and so many other issues, I think, that impact kids and families. So with that,
Senator Wilson, I do have a question.
Yes.
Dr. Ibarra mentioned the churn that is happening as a result of children remaining in the home. And then I wonder if you could talk about that a little more. And if you are seeing children go in and out of care with families who have substance use disorder, and how the department is dealing with that to really, make sure children can remain on a developmental track when their family is having so many challenges.
Thanks for the question, Representative Kagi. Not turning in and out of care, turning in and out of CPS. So coming into CPS, we assess risk as high, we assess imminent physical safety threat as low, not placed, closed to CPS, and then coming back into CPS later. So high risk families with low imminent physical safety threats. And those families get closed to CPS. They get referred to voluntary services in their communities when those services are available, and then they get closed to CPS. So we are not, our child welfare system is not authorized to do anything at that point to monitor the family. We find that those communities that have a richer mix of voluntary prevention services, richer mix of substance use treatment, richer mix of high quality services that are good at engaging families, those communities tend to do better and have lower churn. But sadly, that is not true for most of the communities in the state.
Okay, thank you.
All right. Any other questions for the good of the order? And I would assume if anything pops up, we could use the chat, number one, and two, we could ask to follow up if there's questions that come out of, presentations that follow this that may cause you to think back and reflect. So I know folks would be more than happy to respond and answer any questions. So again, just want to thank so much the three of you for being here. And giving us the lay of the land, if you will, so that we can think forward, because next up is Patrick Dowd, and had the opportunity to spend part of the day with Patrick. It's a week or so ago. But Patrick's the Director of Office of Family and Children Ombuds, and he's going to present the office's 2023 fatalities and near fatalities report regarding children involved in the state's child welfare system, which is really why the information we had before, which relates to this, is really kind of setting the stage for that. So, and Patrick, you're there in person, so I'm going to pass it off to you.
Do a little shuffling of the chairs and have Patrick come up
Okay.
closer to the camera. There we go.
I'll just
Yeah.
squeeze in here. Okay. Good afternoon, members of the DCYF Oversight Board. Again, my name is Patrick Dowd. I'm Director of the Office of the Family and Children's Ombuds. And I really welcome and thank you for the opportunity to present information about our office, our 2023 annual report, as well as our child fatality and near fatality report. Next slide. So I'll run through quickly a little bit of background about our office. I think it's notable that our office was created and established out of child fatality reviews that occurred in the 1990s, and we're kind of grounded in that. I'll talk about our 2023 annual report, as well as the critical incident report in 2023. Next slide. So quickly, our duties and responsibilities. We provide information about the child welfare system. We respond to inquiries. The main portion of our work is devoted to investigating complaints that we receive about families, children involved in the state child welfare system. We also participate in each of the child fatality and near fatality reviews, and I'll talk about those in greater detail. In addition to that, we are required to issue a report each year that describes the implementation of recommendations that are forthcoming from those reports. And then we also publish an annual report and identify systemic issues within the child welfare system and make recommendations. Next slide. So this shows the number of complaints we receive each year. There's been a slight decrease from a high of over 900 complaints in 2019. And this is pretty commensurate also with a reduction in the number of children that have entered state care and that are currently in our state child welfare system. Next slide. And this slide shows the type of, or the categories of complaint issues that are identified in the complaints. I want to make a couple points. One is the orange line represents complaints that the primary issue deals with family separation and reunification. So that's a parent alleging that the department wrongfully removed a child from their care, a child not being placed with a relative, et cetera. And again, we've seen a significant decrease in complaints regarding separation and reunification. Again, I think that is a reflection of the reduced number of children that are entering state care. On a positive note, the gray line is complaints involving child safety. And this is something that we screen every complaint as they come in the day we receive them. And we're looking for child safety, and we will prioritize complaints regarding the immediate safety of a child. And we've seen a decrease in complaints regarding child safety. On the other hand, we've seen an increase in complaints regarding agency conduct, and that can describe a pretty wide variety of complaint issues. That would include a complaint saying that CPS is wrongfully investigating a family, or on the other hand, that CPS is failing to investigate a report that was made to CPS intake. Okay, next slide. So we also track the race, ethnicity of children that are the subject of our complaints. And kind of what we're trying to track is it a reflection of the population of children involved in the child welfare system? And this can help us identify if there are certain communities that we need to do a greater work as far as outreach. In general, these numbers, the complaints that we receive and the race ethnicity of the children in those complaints pretty much reflects the percent of children who are in out-of-home care with the Department of Children, Youth, and Families. You can note that, however, there's American Indian or Alaska Native children are perhaps underrepresented in the complaints to our office. So this tells us, well, maybe we need to do greater outreach work with tribal child welfare systems in Washington State, and that's a project that we currently have underway. Next slide. So this slide shows, well, what happens to those complaints? What do we do? The big blue line going around the circle, and that reflects about 67% of the complaint investigations that we complete. We end up concluding that we're unable to take further action. We are basically validating the work that the department has done. The complainant may feel like, well, wait a minute, this isn't fair, but we at least are able to explain to them why the department's conduct in this particular complaint was consistent with state law and policy. So that might be a parent complaining to us that CPS, in the course of an investigation, investigated their child at school without their consent. And in fact, state law provides that CPS, when they're conducting an investigation, can take that step. Roughly the other, 30-35% of our complaint responses, we are taking some action to achieve a resolution of the complaint. It could be an intervention, which is when we find that action on the part of our office is needed either to correct a violation of law or policy or prevent harmful action and a violation of law or policy by the department's conduct, or monitoring a situation to make sure that complaint issue is resolved and stays on track. Okay, next slide. So we also have a process. Let me kind of back up. I mentioned, whether or not the department's conduct violated law or policy. And that is basically our investigative standard. There are a few main tenets of our office, as well as any kind of classical ombuds office. That is that we're independent, so we're separate from the Department of Children, Youth, and Families. Our office is located within the Office of the Governor. We're objective in that we do not advocate on behalf of the individual that files a complaint with our office. And the reality is sometimes we'll receive multiple complaints regarding the same child or family, one perhaps from the parent, another from a relative caregiver or foster parent, et cetera. So we need to be able to respond to conflicting complaints in many situations in a impartial and adverse manner. And then we have a credible review process where we first establish whether or not the alleged conduct occurred, and then if it did, whether or not the agency's action is consistent with or a violation of law or policy. And we have a process for making an adverse finding when we determine that, yes, the alleged conduct occurred, And in fact, it is a violation of law or policy. We do not make technical findings with the department in the course of our investigations. We might find that there was a violation of policy, but it did not have an adverse impact on the safety or welfare of a child or the rights of a parent or the rights of a foster parent. That would not rise to a level of an adverse finding. We would address that with the department on an informal level. So we reserve the adverse findings for more significant violations of law or policy. In our last reporting year, we made 34 adverse findings. When that occurs, we provide written notice to DCYF headquarters. They have an opportunity to respond in writing. Occasionally, they will provide additional information and ask that we withdraw an adverse finding. So there is kind of back and forth communication. And I'll admit, there have been times when we've got it wrong and the department responds and we've withdrawn an adverse finding. So I think we have a very healthy formal process for sharing that communication with the department. And the point is to, when there is a significant violation of law or policy that we identify in a complaint investigation, that we're able to elevate that to headquarters, the secretary of DCYF, so it can be addressed administratively through the department. Again, because we don't make trivial or technical findings against the department, this past year, the majority of those findings had to do with child safety or parent rights. An example of a child safety finding might be that the department did not conduct required health and safety visits in a child's placement. Next slide. So again, part of our statutory duty is to identify systemic issues. And as I'm sure many of you are aware of, for actually since 2015, our office has been documenting placement exceptions, which is the term used to describe situations when the department is not able to provide a licensed or relative placement that is appropriate to meet the child's needs. And over kind of the past years, we had situations where children were housed overnight in hotels, in DCYF offices, and in night-to-night placements. This kind of tracks the significant increase that we've experienced over the last 8 years. On a positive note, we've seen a slight decrease from 2022 to 2023. One other factor that I want to note, though, is that up until 2022, the numbers reflected, again, hotel placements, office stays, and situations where a child was being transported in search of a placement overnight. So in effect, the child was placed, in a car, as well as more recently in 2021, lease facilities, which are facilities that are not licensed, but that are operated and staffed by DCYF. In 2022, the department also began reporting on children that were placed in night-to-night foster home placements, which I think is very significant. Technically, it's not a placement exception. It is a licensed foster home. But in these situations, the child was placed sometimes like at 6, 7 o'clock at night in a foster home. The department would have to pick up the child the next morning about 7 o'clock. And then that cycle would repeat itself very often in a different foster home. So it had that same level of instability and I think trauma on the child. So in 2022, the department started counting the night-to-night placements, including that. So there's some increase kind of reflected in those numbers in 2022 and 2023 that had not previously been reported. Next slide. And this shows kind of where the placement exceptions are occurring by region as well as by the type of placement exception. Couple positive notes is a significant decrease in the use of hotels. And it also shows that the majority of the placement exceptions have been occurring in Region 4, which is King County, and Region 6, which spans from Thurston County down to Clark County and then up through the Olympic Peninsula. Next slide. And this shows the number of placement exceptions by child. This can be a little confusing, but the main takeaway is that for the majority of the children that experience a placement exception, and in 2023, it was like a little over 300 children. The majority of those placement exceptions are 5 nights or less. So the child comes into care, they might be in a placement exception for 1 to 5 nights, and then an appropriate foster care relative placement is identified. What's really driving these numbers are on the other end. So for example, where we had 64 children spending 20 or more nights in placement exceptions, which reflects over 75% of all of the placement exceptions that occurred in 2023. So on one hand, it's like if we can devote resources to address the needs of these 64 children, we would eliminate 75% of the placement exceptions. Similarly, these children that are coming into care and spending 1 to 5 nights, if we can bolster the resources for those children, we could pretty much eliminate all the placement exceptions. Next slide. So we looked at these 64 youth that spend the majority of the placement exceptions and what happened to them. And this shows, and this might help identify where the services are lacking and what types of resources need to be expanded. We found that 18 of those 64 youth were then later placed in BRS placements. 9 returned home to a parent. 5 moved on to the extended foster care independent living program, and another 3 into extended foster care. So this kind of shows kind of what happened. Interestingly, many of them remain in a problematic or difficult, well, I'll let you make kind of fill in that description. 5 were still in the DCYF lease facility, so we did not identify a long-term placement. 4 were in juvenile detention facilities, 2 aged out of foster care, and 3 were missing from care. This shows kind of the breakdown by age. And again, the 10 to 17 age bracket, and more specifically, the 15 to 17-year-old age bracket, again, makes up the majority of the placement exceptions. We do track race and ethnicity. I'm not sure how much to read into it on a year-to-year kind of basis, but I think that's something that as a system we need to look at as far as disproportionality at all stages of our child welfare system, including the race and ethnicity of children experiencing placement exceptions. So on a positive note, this shows what's happened since July up through February 2024. And it notes a decrease in placement exceptions, including night-to-nights, and specifically in Region 6. Next slide. And this shows placement exceptions by type of placement from September through the end of January. Let me kind of back up a little bit. Our annual report is published in November each year, and our reporting calendar runs from September 1st through the end of August. And so that's end of August, then we work on publishing our report. So the information in our annual report reflects data from our reporting year of September 2022 through the end of August 2023. This information is kind of an update of like, what are we seeing now? And again, some positives are a reduction in hotel stays, that there have been no office stays, also a reduction in night-to-night, and then kind of finally the number in leased facilities. So what's happening, what's being done to address this issue? The department has established, again, 2 leased facilities, one in King County and one in Lewis County. The one in Lewis County has much more of a kind of family kind of vibe, if you will, to it. The leased facilities are staffed by dedicated staff, so there's some consistency for the youth that are staying at the leased facility. The leased facility in King County was previously used as a congregate care facility. It has more of a kind of an institutional feel than the home environment that the leased facility in Lewis County has. DCYF has recently partnered with the Developmental Disabilities Administration to operate the leased facility in King County. And there are 2 wings, and one wing will be dedicated to children that qualify for developmental disabilities services. And then the other wing will continue to be a resource for children involved with DCYF. The other piece is the DS settlement agreement and implementation. And I won't go into all of the details of that settlement, but the main takeaways as far as expanding placement resources are expanding emerging adulthood housing program, creating a professional therapeutic foster care model that would, again, have a professional level of therapeutic foster parents that would be able to meet the complex needs of some of the children in care. And then also expansion of a statewide hub home model program with the goal of stabilizing children in foster care and avoiding disruption of placement. And then my final remark is not this most recent legislative session, the previous legislative session, there was a bill passed to create a Children and Youth Multi-System Care Coordinator. And this was really to address the issue of children that were experiencing boarding in hospitals, and a child that's ready for discharge from a hospital, no longer needing that level of psychiatric care, but because different agencies within our state child welfare system did not have adequate resources, no one was stepping up and saying, I can meet this family's needs. So this creates a crisis care coordinator position in the governor's office to be able to respond to this situation and be able to work with the Healthcare Administration, DSHS, DCYF, and identify what agency is best situated to meet the child and family's needs, and to provide appropriate services and placement for the child. Next slide. All right, now I'm going to transition into child fatalities and near fatalities. Again, I just want to remind you, if you're going back from like the numbers or the graphs that are in our critical incident, child fatality, and near fatality 2023 annual report and what's here, they might be different because I wanted to provide the most up-to-date number that I can. Representative Sen, do you have a question?
I do. Thank you, Patrick. Has the governor's office actually hired for that position for House Bill 1580? I know they had not as of February, which to the other shock and frustration.
I know that the first phase of interviews occurred and within the past month, and that it's moving forward at that next stage. And I'm not sure kind of where that is, if they've completed the second round of interviews or not.
Thanks.
Senator Wilson?
Thanks. Just before you move on to fatalities, I just had a question around the data around the placement exceptions. Is that okay if I kind of ask that? And that's,
you bet.
You had other, male, female, trans, and then you had other, and I'm just wondering if that is inclusive of gender expansive youth or how we're collecting information. One of the conversations I've been having with nonprofits and CBOs, especially that are placements for young people, is kind of how it is they're placing gender expansive youth who don't necessarily identify on your traditional continuum of male or female. Just curious around whether that kind of is under other or whether we're not collecting anything around that.
Senator Wilson, that is a good question, and I'll have to follow. I don't want to shoot from the hip here. So
okay.
I think it is youth that, let me follow up and get a definitive answer.
That's fine. Thanks a lot. I don't want to put you on the spot.
No, that's okay.
Okay.
All right. Okay, so I want to start by saying these numbers, the blue line represents the number of child fatalities that OFCO is notified of by DCYF. Okay, they may or may not be related to child maltreatment. And it is certainly does not reflect all of the child fatalities, obviously, that occurred in the state of Washington in the past year. So this reflects child fatalities where the DCYF was notified, and then through their reporting system, our office is also kind of receives notice of those fatalities. We then kind of conduct a review of those cases to determine, was there prior involvement with DCYF? What were the circumstances around the fatality? Is there an indication that it was related to child abuse or neglect? Senator Wilson, do you have another question? Okay. The orange line indicates of those 78, our office, these are the ones where we identified the fatality may have been related to child maltreatment. Now, that doesn't mean that it was directly caused by abuse or neglect, but we were able to identify child safety concerns that may have had an impact on the critical incident. And then finally, the gray line is the number of fatalities that qualified and received an executive child fatality review. And that criteria is one, that fatality was attributed to abuse or neglect, and two, that the family had was previously receiving services from the Department of Children, Youth, and Families in the preceding 12 months. Okay, in this slide, similarly, but this is not child fatalities, this is child near fatalities. And let's jump back one slide to fatalities. Sorry to make you do this, Krista.
No, I apologize. I'm jumping back.
Okay, so this actually shows kind of a maybe a slight increase in some level, in some areas, a slight decrease in the total number of fatalities. And then when we jump to near fatalities, we see that each of these areas has increased. So we've seen a steady increase since really 2018 in the number of near fatalities that we've received reports on. Similarly, an increase in those that we said, you know what, it looks like child maltreatment may have been a factor in this critical incident, as well as, except for a decline from 2020 to 2021, a continuing increase in the number of child near fatalities that qualified for a near fatality review. My takeaway from that is, particularly when we're looking at the numbers from 2021 through 2023, is the impact of fentanyl. Next slide. So then this is, again, this combines both fatalities and near fatalities. The near fatalities are in blue. The child fatalities are in orange. And it shows kind of by year. And these are the critical incidents that are that involve the ingestion and overdose of drugs. So it would include all drugs. And again, when we look back to 2017, 2018, even into 2019 and 2020, this was not a significant driver of critical incidents. And then it just skyrockets in 2021, 2022, and 2023. Next slide. So then we broke it down further and looked at, of those critical incidents, how many of them involve fentanyl? And, again, I think the chart really speaks for itself as far as the impact of the fentanyl crisis on our child welfare system and child fatalities and child near fatalities. I hesitate to say there's any silver lining in this, but I think in kind of reviewing them, and we do see that there are more near fatalities than fatalities. And a common factor in many of these cases is that naloxone or Narcan is used in a very timely manner, and that is, and the child is revived. We also looked at the children under the age of 11, and this kind of really captures the dynamic of the accidental ingestion of fentanyl by children. And I want to kind of pause and talk a little bit more about this, because it is, I think the number one factor, certainly the number one factor in the child near fatality reviews that are facilitated by the Department of Children, Youth, and Families. It is exactly this situation where we have a child, an infant or a toddler, who is able to get his or her hands on It might be residue and foil, it might be a pill, and there's an accidental ingestion, by the child that results in the critical incident. This is not situations where we have, this is not capturing, again, it's accidental ingestion. So we're not talking about, a child that is using drugs and overdoses and has a critical incident, but rather this is the accidental ingestion, by a child. And again, when we go back to 2018, 2019, this was not on our radar as a problem. It was not something that we would commonly see in participating in the fatality reviews or near fatality reviews. And now it is really kind of the driving factor in these reviews. Next slide. So I already kind of talked about the criteria for what qualifies for a fatality or a near fatality review. Again, the key takeaway is that it has to be suspected to be caused by abuse or neglect, and there was prior DCYF involvement. So there could be, a CPS intake and a fatality or near fatality it's a toddler that ingests fentanyl. It will not receive a review if the department did not have prior contact or involvement with that family within the preceding 12 months. So we're talking about a kind of a smaller subset of the larger world of fatalities or near fatalities. The child fatality review reports are published on a DCYF website. The department also produces quarterly reports that summarizes kind of key findings from those reports. The near fatality reports are not published, and I won't go into kind of too much detail on that, but there are state and federal laws governing the confidentiality of child welfare records that I think place greater restriction on near fatality cases, and the department has wider latitude to publish the child fatality review reports. The review process is facilitated by the department. The review team itself extends beyond the department. So this is not an internally conducted review. It does involve DCYF staff. So for example, they'll usually have a program manager with expertise on safety assessments, for example, or CPS investigations. But the review team is also made up of community members with expertise relevant to the circumstances of that critical incident. So for example, if there were issues involving domestic violence, they would have a community member with expertise in domestic violence treatment and resources. If the case also involved a law enforcement investigation, they would pull in a law enforcement officer to participate in that review. So the review teams are designed for the specific circumstances of the individual case. They are made up of individuals both within the department as well as individuals in the community. All members of the review team, or let me phrase it in a different way, none of the review team members had any involvement with the underlying case. So they all come in with that level of impartiality. And then our office, each year, as I mentioned, we review what happened to those recommendations that were made at each of the critical incident reviews, and we report out on what happened. And in our last review of the critical incident recommendations, we found that 60% were implemented by the Department of Children, Youth, and Families. 12% were considered but not implemented, and 21% were not implemented, but because the recommendations reflected existing law or policy. The department is also going through a slight kind of modification of the critical incident review process so that there will be kind of a quarterly review by the department to review all of those reports and then identify recommendations that should be made in response to those individual reports. Next slide. Okay. So this again describes the child fatality and near fatality reviews that occurred in 2023 by region. Next slide. This shows the near fatality and fatality reviews that occurred and lists the cause of the fatality. And so 27 of them were directly related to the ingestion overdose of fentanyl. Another 4 were related to multi-substance, including fentanyl. And then there was an additional drowning where fentanyl was a contributing factor. So again, the takeaway here is the impact of the fentanyl crisis on child fatality and near fatalities. So as far as the response, the main takeaways from the critical incident reviews dealing with fentanyl fatalities and near fatalities, the main takeaway, the recommendations were for expanded training, both for DCYF staff and for the families that they're working with on the dangers of fentanyl, and safety planning around fentanyl, and then also services and supports, everything from providing lock boxes to families, to testing strips, to mouth swab testing kits for caseworkers to simplify kind of the testing process, as well as the impact of 6109 that clarifies the legal standard for the threshold for removing a child when there is imminent physical harm and the impact and the lethality of fentanyl, as well as the training that is also described in 6109. And I'm ready for any other questions. Representative Sen?
Yeah, thanks, Patrick. And I don't know if Vicky is still here, but when we were presented something back in October around fentanyl, if I recall, there were 2 biggest causes of deaths was domestic violence and fentanyl. And then in your near fatality review, domestic violence wasn't on there. And I'm wondering if there definitely was something that was domestic violence was still the -- 1 reason, and then fentanyl was the -- 2. And I was pretty sure it was around the fatalities or near fatalities, but I didn't see that in that chart. Do you have anything on that?
Yeah, quickly. So we've looked at in each of our reports on fatalities and near fatalities, we've looked at significant factors present in the home. And that doesn't mean that it was like the cause of the fatality or near fatality. So, but the 3 main factors were substance use disorder, mental health issues, and domestic violence. So the fatality itself may have been related to neglect or co-sleeping or fentanyl ingestion. But we were looking at what are the factors that were identified that brought the family kind of to the department's attention, kind of related to possible parental deficiencies, and domestic violence was one of those. But I don't think our office identified it as a primary cause of the critical incident itself, if that helps.
Yep, thanks.
Diane?
Yeah, and I'm just going to tell everybody you are going to get your 10-minute break. We will use a little bit of, I think we're going to make up some time towards the end of this, so don't worry, we'll get there. But my question is, Patrick, that group of kids that Vicky was talking about where they were assessed, but then they were basically relegated to voluntary services. And then she said that, if the families didn't take anything, there was really nothing they could do. Would those, if that group of individuals had a near fatality or a fatality, would you get that report? Or because they did not get any services from DCYF, would that not be included?
No, that would be
Does that make sense?
included. So
Okay.
Receiving DCYF services is broadly interpreted. That would mean like an open CPS investigation or family assessment response case. And the family might say, we don't want services, go away, and the case is closed, but that would still qualify for a critical incident review.
Okay, great. Thank you for that clarity.
Tom, did you have another question, or is your hand just still up? Okay, Danielle.
Yeah, so part of this is just clarification, what we're seeing in the field starting in 2021 until now with fentanyl. And then the other one is just kind of clarifying questions regarding the recommendations that came from this report. So as a field worker, I've been with the department since 2018. So in 2021, what we were seeing is that the courts were already implementing 1227. And even to this day, we have a lot of courts throughout the state who are not considering fentanyl to be a reason to remove or to do in-home services. Kind of coupled with that, I know a lot of the recommendations regarded staff and having appropriate staffing levels, and a lot of it regards on steady long-term case management. During that same period, we were seeing, and we still are seeing, a very, very huge vacancy issue. We have one office in King County who has a whole program that has been shut down and has been shut down for 6 months. I went through last night and I read probably 15 to 20 of the published fatality reviews from the past couple of years. And I noticed a going theme seemed to be that supervisors were case carrying, they were having challenges providing appropriate clinical guidance to their workers because of case carrying. Multiple workers were touching a case because there's only 1 or 2 workers in those units, relying on other offices. Some offices have huge, large regions and areas that they cover. So that becomes challenging to respond in a timely manner. So context, and then the question, has DCYF provided the ombuds any clarification about how they're going to implement these recommendations? Because I know some of them mention like they're already in policy regarding like some of the staffing issues, relying on other offices to kind of pick up that casework. But then we're seeing some things fall to the side, right? Like we have a CPS worker who has 50 plus cases covering another office, getting out and providing services is challenging. So did DCYF, when they were provided these recommendations, provide any clarification on how they were going to do that? Or is it most of it still in process?
So, first of all, I want to just kind of underscore your remarks. Everything about kind of the early implementation of the change in the legal standard for removal, the challenges that that posed for caseworkers. Those are common themes that come up at the many of the child fatality reviews. Similarly, the staffing issues that you've discussed are also described by supervisors and caseworkers when they're interviewed in the course of these reviews. And as well as the how that reverberates. So a unit is understaffed, then a supervisor is carrying cases, then the supervisor isn't available for mentoring and supervision. As far as how we determine whether or not a recommendation is implemented, yes, the department does provide a description to our office of what steps were taken to implement a specific recommendation. And we try to summarize that in the appendix in our annual report.
Well, I don't know if there is anyone from the department on the call at this point. Is there?
Allison will be on after our break. If there's some questions she may be able to respond to.
Well, maybe Patrick has some perspective on this, but there were two recommendations that said not implemented. And one relates to an issue that the Oversight Board has had previously that we haven't been able to discuss with the department. The recommendation is to create adolescent-specific caseworkers in all areas of casework, CPS, CWS, and CFWS, and adoption. And it just highlighted to me again, what is the department doing to address the unique needs of adolescents, which were called out in the authorizing legislation?
I would have to defer to the department to respond about that. I am aware that there were concerns among some child welfare stakeholders about changes to the DCYF adolescent unit. And I had preliminary discussions with the department around that. And kind of the takeaway from my understanding is what the department was kind of embedding those duties and responsibilities kind of within the department rather than within a dedicated adolescent unit, but it did not reflect a kind of stepping back from meeting the needs of adolescents. So, but that's a vague answer, a vague response. So I think the department would really need to respond.
The other issue, and maybe the caseworker can respond to this, is we also recommended in prior reports, and the fatality review committee recommended providing mental health supports for caseworkers. And that's, I think we did that 2 years ago and maybe a year ago, and it said in the report in process. Have you talked to the department at all about that?
No, and that was one of OPCO's recommendations in our most recent annual report, and it was related to caseworker safety, and that it's an issue that comes up in placement exceptions with caseworkers that are supervising children, youth in less than optimal placement. It comes up when caseworkers are serving a pickup order at a residence with parents that the worker may not have even met before. And then it also comes up with secondhand trauma from the caseworkers that experience fatalities and near fatalities on their caseload. We've individual reviews have brought up and recommended when this happens to a law enforcement agency, they're taken off kind of their caseload, and that
So
that
you're
a
not
similar
sure
policy.
what the department
No.
has done or where that is.
No.
Okay.
Yeah, and to just provide a little further clarification. So currently the department does not have any sort of administrative leave for critical incidents that workers would be involved in. So near fatalities, and those sorts of things.
Rep Sen?
Yeah, we passed legislation a few years ago requiring reflective supervision be installed or be incorporated into management, and I think that's also something that has not happened. I think that I know the department will probably mention that they were looking at the workforce study. They were conducting a workload study, and to then, given that, start developing more of an official supervision program, which frankly, there really isn't any dedicated supervision structure. And so I think that is something for sure to hold the department's feet to the fire now that, that workload study that WFC requested is complete. What are those recommendations, and what is the structure, supervisory structure that will go into place or be recommended, and how does that roll out? So I think that is definitely something we should continue to ask and inquire about.
This is Krista. I've just been informed Allison has actually just joined us and is happy to respond to those questions, I believe, right now, right before we take a break, before your actual formal presentation begins.
And then
Is that
I see Ben's got a question as well. So before we jump off to.
Feel free to take Ben's question. Rep Sen captured what I was largely going to say, and I can talk about that a little bit when I go later after the break.
Okay.
I just have
My
a
apologies.
thank you. I just have a very quick question about the criteria for near fatalities. That's obviously jumping up and going through the ceiling. And I'm wondering, do we have any definitional changes in what a near fatality is? And how do we define them now?
So a near fatality is defined in the RCW, and it states that a doctor or medical provider states that but for medical intervention, the fatality would have resulted from the event.
So the injuries are so severe that they would have led to death had there not been a medical intervention. Do I have that right?
I didn't know.
If the injuries are so severe that it would have led to a fatality had we
Correct.
not had a medical intervention.
Yes.
Yeah, thank you.
Okay, I think, Allison, since you're on, I want to just check with you. If we take a 10-minute break, are you cool with that? Okay, so I've got that it is 2:19 right now. Let's try and adjourn at, or again at 2:29. See if we can get off by then. All right, everybody gets a 10-minute break. Thank you.
That was interesting, Patrick. Thank you.
All right, everybody is timely. That is awesome. So it's amazing at 9:29 people come back, or 2:29. If we'd said 2:30, they may have not come back. So who knows? Anyway, we are having our next presentation, and that's from Allison Kritzinger, who is the Director of Public Affairs for the Department of Children, Youth, and Families. And her role in our meeting today is to really give us some highlights from the 2024 legislative session that just concluded, to give us an overview of some of the new pieces of legislation, issues around implementation plans, and also kind of what's next on the horizon for DCYF. So with that, Allison, welcome, welcome, welcome. It's all yours.
Great. Thank you so much. It's good to be with all of you today. Apologies for not being in the room with some of you. I have retreated back to my island post-session, and I'm not super stoked to get back on a ferry and leave again for a few days. So I'm working from home today. So appreciate the ability to be here virtually. As Senator Wilson, Chair Wilson noted, I will do a little bit of our legislative highlights. I do want to just take a moment, sort of piggybacking on the conversation there right before the break. I think you heard very accurate description from members of the Oversight Board who are on the DCYF staff and do this work every day. And then also Rep. Sen mentioned the workload study, connecting some dots and sort of providing some high-level context. DCYF anticipates having a decision package prepared for the biennial session related to the workload study. Our initial time study work and work with PCG is done. That report has been published. The next step of that to complete a true workload model and report is really to understand and make choices around with that information, right? Cases, case weights, how many caseworkers for what roles. I think you'll see some of that adolescent unit conversation come into play there, as well as sort of overall work. I also just want to highlight that we are seeing levels of vacancies decrease, and it is not consistent across the state. King County remains one of the hardest regions to recruit and retain in. We would speculate largely because of the cost of living. Also, King County often has the highest number of cases of kids in care, given population and geography. And so we are seeing sort of at a whole, at a macro level, fewer number of kids in care than we've seen in decades, and we have the highest number of staffing and FTEs that we've had, and we are seeing positive trends in retention. There's a lot of data in there to unpack, and then the experience varies widely by office and by region, given sort of those unique realities in the moment in those spaces. But did want to highlight that. And I think probably it would make sense, and I will think about timing in partnership with folks leading the workload study, and we can work with Oversight Board leadership on a report back to this group on the workload study. That feels like a logical next step, piggybacking on this conversation, and some updates on that work as it sort of hits the next phase. So I don't know if I'm supposed to, Senator Wilson, I'm going to defer to you on when we take questions, or Chair Levy on when we take questions.
Yeah, and I think, you know, you are on the docket until I believe 3 o'clock. And so, you know, if you think about it, if there's some obvious chunks that make sense for you, I do want you to be able to get through your presentations. So
I just see
I'm going to pass it back and let you go.
Okay. And happy to follow up too, Ben, if there's conversations about the workload study. I'm not super in the weeds of it. I'm sort of coming up from air post legislative session and diving back into the weeds of stuff. So I'm not super in the weeds, but feel free to send an email or through Krista, connect with us if there's specific questions on the workload study pieces. I am going to share my screen. In theory, I know how to do that. And what I'm going to do today is walk through some of the legislative highlights. The slide deck that I have here, and I'm going to remember how to put in presentation mode. You see me frantically moving around here. Can you all see the screen in presentation mode, or is it in notes mode? Okay, we're good. Okay. I have a lot more information in this slide deck than I will talk about today, but we'll send Krista and staff have available, and they can share with you. We also did our overall external webinar yesterday, and that will be posted on our website, the entire slide deck and the recording that our Chief Financial Officer, Renee, and I did. But I did want to highlight a few things as we sort of move in. So I will breeze through some of this, but in the interest of not having multiple decks floating around, sort of I'm keeping some of the things consolidated.
So Allison, you may want to put it on slides
didn't.
beginning here, because we're seeing your messages coming up on your does that make sense? Starting a slide, you weren't on a slideshow, you were just.
Okay. You would think years after knowing how to do these things, I would know how to use Teams or Zoom. Okay, let me try this again. Share screen. We'll do, oh, it's going to show the notes. Let's see, PowerPoint slideshow.
Yeah, from beginning.
Okay, what are you seeing a slide that says child welfare bills?
Yep.
Okay, excellent, perfect. So the first few slides that I had clicked through were largely just context setting realities that, you know, the only reality I think I'll highlight here is DCYF is implementing tremendous amount of change across every part of our agency. We rolled hundreds of millions of dollars out the door in grant funding for childcare providers and others to stabilize during the pandemic, implementing reform in the juvenile justice system with the implementation of the Community Transition Services Program coming online, as well as the continued realities of serving an older population through the JR to 25 laws, as well as then significant implementation in the child welfare space with 1227 passing, the removal standard changing, and a variety of Supreme Court cases that impacted preference placements, Indian Child Welfare Act law, as well as a variety of other things. So that was really a guiding reality as we built our asks heading into this legislative session. It's also a supplemental year, which is intended to be short, fast, and really about tweaks and modification. So I named that. I will note, having done this work for a long time, this session really felt like a true supplemental session. It was fast, it was furious, it was hard, and it was very limited in scope. Unlike some of the more recent supplemental sessions, as we were sort of grappling with one-time federal investments and changes and responding to a crisis, this session sort of took us back, I think, to feeling a bit more like a traditional supplemental year. So I do want to highlight a couple of the pieces of legislation that passed this year that have significant impact to the agency. This is a list of bills that sort of broadly impact us. I'm not going to go into detail on all of them, but I do want to highlight the Extended Foster Care Bill 5908. So this was a bill introduced last year and ultimately passed this year that definitely changes how we are going to implement the Extended Foster Care Program. It creates an opt-out versus an opt-in, and ensures that young people are entitled to the financial support that comes with being in extended foster care, regardless of their participation in one of the five federally required activities. So the feds require for federal reimbursement, participation in school, work, resolution of barriers, medical, etc. The state law says that doesn't matter anymore, and we're going to use state funds and ensure that young people have those resources when they are in extended foster care. This will certainly shift how we do the practice around extended foster care. We anticipate serving more young people through the extended foster care population, and will definitely shift some orientation and culture around practice, which was largely the goal. This bill also then says, please develop recommendations on an incentive program to incentivize young people to continue to engage and participate in those five categories, which are largely about stability and skill building, really pointed towards sort of long-term success. And so we will work on that this interim and ideally have recommendations for that, as well as potential other recommendations in the extended foster care program. And I anticipate seeing probably some decision package or agency request legislation that contemplates this next year. Also thinking about picking up the conversation around housing. Although now all young people will get this payment, and in 2025, that payment will increase slightly. It is certainly not sufficient to sustain and maintain living arrangements, especially in some of our more expensive counties. We had an ask last year around housing that ultimately didn't get funded. Advocates also this year had an ask around a housing supplement. So I anticipate you will continue to hear the department lean into this space, both on housing and practice needs and realities. I also want to highlight 6006, which was a bill that codifies the requirements in CAPTA, which is the Federal Child Abuse Prevention and Treatment Act legislation around supporting victims of human trafficking. This is a bill that requires the department to screen and assess suspected young people who may be victims of human trafficking and then offer services to those that are part of the dependency system. This will be an area that, again, we will continue to work on this interim as we continue to try to stand up the receiving centers. We did get a bit of increase in funding for the receiving centers we have struggled to have interested parties be able to operate just given the limited resource there. And so some more resource for that coupled with this bill, I think this will be an area you continue to see us lean into on around implementation, but also likely coming back next year and thinking about what are the services that young people who may be victims or have been victims or have the potential to be victims of human trafficking need. This is especially timely and appropriate given the World Cup coming to Seattle, and there's a lot of interest from stakeholders and folks focused on the impacts of trafficking in sort of large sporting event realities, which is just a reality that we're gonna need to grapple with. So anticipate more conversation this interim as we implement and look towards that. The last bill I'll talk about is 6109. I know you were joined this morning by Dr. Ybarra and some folks from DOH to talk about the impacts of fentanyl and fentanyl largely. I want to dive into a little bit of the detail on what 6109 did. This is a bill, and fortunately you have Senator Wilson and Representative Sten on this call who really shepherded this process with tremendous leadership and grace. Probably one of the hardest issues I've ever worked on in my career in this space. And so I'm pleased with the outcome and a real unfortunate topic that we all had to grapple with this year. But as folks know, there has been, and I was listening to part of Patrick's presentation, an increase in critical incident. And we really saw, and our social workers really saw, inconsistent application in courtrooms across the state when it came to the risk of imminent physical harm, which is the removal standard that now exists and was part of the law change, but application of what that means when fentanyl is involved in a home, in a life, et cetera. So we really took a perspective from the department in strong partnership with our labor partners and working closely with other advocates that we maybe didn't always align with perfectly, but worked really closely and respectfully together this interim to come to a solution that really tried to clarify for the courts the risk that fentanyl, high potent synthetic opioids does provide and does create in homes, and then how the court should contemplate that. So ultimately where the law landed is the law now requires the courts give great weight to the lethality of high potency synthetic opioids driven by the public health guidance developed by the Department of Health. This exists when considering a variety of things: pickup orders, placing or maintaining shelter care, participation in prevention services, and then whether manifest danger exists. So we think this is part of the approach to help combat sort of the challenges around safety, supporting families that exist with the just increase of the prevalence around a fentanyl epidemic in our communities, in our state, and frankly, our nation. This just goes into a little more detail on the definition and what highly potent synthetic opioids fall into that. There was a lot of question around, we don't want to have unintended consequence, right? And capture more than what we're trying to solve for here. And so a little bit of context there. The other thing the bill did, as we think about the court challenges and some of the application in the courtroom and just realities in the courtroom, the bill requires AOC to offer additional training to superior courts that receive their grants around the dependency process as a whole, the removal standards, et cetera. So really, really leaning in to say, how does the judicial system also need to make changes to support these new realities and fentanyl and just in the dependency system. And then also working with the Department of Health and the Poison Control Center to build relevant and helpful public health guidance around the risks for young children. And then the last part that the bill did was took a services approach. So part of the strategy and part of the solutions here is not all children need to be removed. In fact, the department's goal and mission is to keep families together and support that when that can be done safely. Child safety is our mission. It is why is our priority. It is why we exist. And so we recognize that oftentimes services, treatment services, other types of services can help maintain that safety of that child being with their family and not having to go through that removal process. So there were a variety of services that were included as part of the funding in response to fentanyl in 6109. I won't go into detail on all of them, but we'll highlight many of these, especially the first two, the public health nurse pilot and safety plan participants really came from the field. We talked to a lot of social workers as we were sort of building the governor's budget in partnership with the governor's office and OFM. And they had recalled pre-recession, often CPS investigators were joined by a public health nurse when they were doing investigations. And so we asked for some pilot to stand that back up again to say, you know, does it help when we're investigating some certain types of cases to have sort of that public health nurse approach engaged in that process? And so I will note these are pilots. These are one-time, one-year funding in fiscal year 25. They will likely be small scale in the first year, and we'll implement and learn and then make some choices around what we come back and ask for or don't, depending on how they go. The other is around safety plan participants. So one of the things our caseworkers do is work really hard to safety plan with families. Again, if a child or children can maintain their relation, can be in with their family and do that safely, that's really ideal and the best outcome for kids to be with their parents and their guardians. And part of that requires putting safety plans in place. For some families, they have robust and rich natural networks of support that can lean in and help be extra hands and extra support with children as parents are mitigating and working on the realities that may cause risk or potential safety threats to children. And for some families, they don't have those natural supports. And so one of the ideas that came from caseworkers was to say, what if we had the option for families where we think safety plan participants can help stabilize, reduce the risk and the threats to safety, keep that family together? We had the option to bring in some third-party contracted safety plan participants, really to be that extra sort of safety plan. So that's another thing that was funded. We're excited about that. This is new. This is an innovative approach. Again, it's small in scale. We're going to have to target a few communities, a few geographies, and be able to implement and roll out some contracts there, but are excited to have this resource to learn from, to see and learn how it may or may not continue to support the safety of children remaining in the home. The others are contracted slots, which gives the department the ability to sort of purchase capacity. So there's open capacity in both home visiting programs and childcare for infants. I don't know if anyone on this call has tried to find infant childcare lately. It is a heroic effort. And often for families who engage in our system and are involved in that child welfare system and have, especially infants, childcare can really make a difference in giving parents the time to mitigate and work on things that may be impacting their stability and child safety. And so it's not helpful when we say, hey, childcare would be really helpful, and here's a subsidy so you don't have to pay for it, but now you need to go find it. That's an event in and of itself. And so this really gives the department the ability to contract with some childcare providers, to have capacity available that will create a direct referral. And so when that family is identified, childcare is identified as part of their safety plan, they can call that childcare provider, and if it meets their needs and is a good fit for their family, that slot will be available to them. Again, this is a small pilot, couple areas, gives us an opportunity also to test some contracting in childcare, which I think will have other long-term benefits as we think about some of the childcare work that's happening inside the agency long-term around wages and increased rates. So we're excited about those. The other is the Intercept evidence-based program. This gives us the opportunity to pilot a new combined in-home service or in-home service for families who are involved in child welfare in 2 communities. We're excited about that. This is built in the Youth Villages model, which is part of our LifeSet model, which is our practice model that we use a lot with adolescents through contracted providers. So excited to bring this new service online. And then the last piece here, which I think is exciting, and I appreciate the legislature sort of leaning in response. Part of the challenge that we observed and we have all collectively heard about and talked about is just the realities of social workers navigating the legal system and courtrooms. It can often be not the most pleasant part of their job, not the most exciting part of their job. And so this provides some resource within the DCYF regions to support some additional legal capacity for young people or for social workers who are doing that. What this looks like yet, we don't know. It's really open-ended and gives us an opportunity to respond to some of the needs around that the legal realities for social workers in partnership, obviously, with our AGs, but create some legal expertise in the regions. I'm gonna pause. I see a question from Lois.
Hi, Allison. I have a question on for the very, do you have an idea of how many nurses will be served? What the breakdown, I'm obviously at the center, sorry for the background noise. What the breakdown will be between DCYF admin costs and how much of the money will actually be out in the field?
For all of it or for the contracted childcare slots specifically? Sorry, you cut out a little bit.
Well, no, I'm sorry. Just a rough idea.
So this is all service, these are all service dollars. DCYF has an indirect rate and an admin rate on top of and outside of these. These are all service dollars. There may be some staffing costs built into these, like an FTE here or there that we got to have staff to implement timely and well and sort of monitor. But these are all dollars that are intended to fund sort of held slots or fund the contracts for safety plan participants, run the Intercept program, et cetera. I will note the legal liaison one, that is all staffing. That is staffing for the DCYF regions and child welfare. But these are all intended to be service dollars.
Okay, when you have an opportunity, maybe as a follow-up through Krista, next, I'd be curious to see for the as the estimate of how many families or children will and youth will be served.
I think I heard that about how many youth or children, families, or youth will be served through these various parts. Yeah, that's a great question. We will build, we built some rough estimates and models as we built the funding request as the governor's budget was being built. And so have some idea of, and some of the provisos and bill language lays out different numbers of slots. And so we'll have all of that. That'll all be part of that implementation process. Great question. Happy to continue to follow.
Thank you.
Yeah, thank you.
Thank you.
So the next, oops, now I'm on the wrong screen. Okay, the next few slides run through a variety of the investments that were funded in the final operating budget, both in the Partnership Prevention Services Division and the Child Welfare space. I did mention the CSEC receiving centers. I want to highlight that one. We'll see a rate increase for our family preservation service providers that will go into effect July 1. A part of our independent living ask was funded. We had an ask to sort of backfill some of the decline in federal funding from the Chafee grant related just to the decline in number of kids going into care. This is a grant that is sort of an allocation based on kids on care, sort of your proportion of the dollars. And as our overall population of children in care and youth in care has decreased, that funding has gone down. And so the state put some dollars in to maintain that level of funding, as well as provided ongoing funding for 4 of the 7 transitional living specialists. The other, on the next slide here, we had an ask around our FTDM facilitators, which was the final strategy in the DS settlement. We had an initial ask last year that we pulled back because we, in partnership with the plaintiffs and stakeholders, decided needed a little more refining. And so came back for that. We're pleased to see that funded. That will add more FTDM facilitators into the child welfare space and the regions. We see a rate increase for our EPS or our emergent placement beds, and then a foster care maintenance payment increase that will go into effect not this July, but the following July. Pivot really quickly to early learning. Lots going on at the department, so I'll go quick. I will note this year felt I noted earlier like a traditional supplemental, less action here. We had one piece of agency request legislation related to the Early Supports for Infants and Toddlers program. I like to think of this largely as technical, although lawmakers and budget writers might not agree that a $4 million bill is technical in nature. But this bill really aligned billing realities and billing practices with service realities. So providers could bill for that first month that a child receiving ESIT service receives that service. So we're excited to make that change. A couple of bills that expand who's eligible for working connections and streamline some of that income eligibility verification when a family is also receiving SNAP benefits or food benefits. 5774 allows and directs DCYF to stand up fingerprint capacity in our offices. We're excited to do this. I will note the final law and funding don't match. So we've got to make some choices around implementation and then likely come back with a supplemental or with a second supplemental ask or a technical ask next year. Regardless, we are excited to have some resource and some direction to be able to roll out additional fingerprint capacity, especially in rural areas where those fingerprint vendors aren't consistent, aren't open or don't exist or have a lot of turnover in sort of their availability. This is both critical and necessary for the childcare workforce, but also really is an advantage and supports our child welfare population as we think about young families and that those natural supports I was talking about being part of the conversation, like when they're in the office for an FTDM, if they can have fingerprints done there, really can expedite some of the background check pieces. So more to come on implementation on this. Like I said, the bill changed late and sort of the final language and final funding don't exactly align. And so we'll make some choices on implementation, but certainly we'll start rolling out this capacity in our offices. Few rate adjustments in the early learning space, non-standard hours and infant rate enhancements, as well as some ECAP rate increases. A variety of provisos funded in the early learning space. Additional professional development for the Imagine Institute, focus on coordinated recruitment and enrollment as we work to align a mixed delivery system that has lots of different types of early learning programs, some of the capacity to do some of that recruitment and that coordination and recruitment and enrollment on the ground, increase in our early childhood mental health consultation program, and then some specific provisos for various communities that were largely direct asks of members. No bills in the juvenile rehabilitation space this year that impact us, but a variety of funding investments. So we'll note that some funding for gender responsive care through an organization that supports the women in our system, although a small population, a population that is critically important. And so we're excited to see that. And then additional security and support at Echo Glen, short-term, one time as the perimeter fence is being constructed there. And then funding for our class action settlement related to administrative hearings. This is really about due process and justice for young people who are moving to and from the JR system to the DOC system or in that community facility move. And so standing up an administrative hearings unit to handle some of these realities in these cases. Some capital investments in our JR space. That's largely where our capital is. So capital investments in our JR space here. We got funding for our child welfare case management system, our CWIS system, which will allow us to move forward with implementing some of the feasibility work. I will, spoiler alert, I think CWIS will be an ask every year for a while. This is a major technology overhaul to redo and redesign FamLink, which I am not a caseworker. I have tried to engage in FamLink on the back end, and given how much better technology can be, I'm excited for these technology solutions to come online really to support the workforce with better technology tools in more real time. And then we will highlight our SEAMS proposal. This was a DP that we asked for that was really about how do we support staff in response to critical incident. A little bit of that conversation earlier today. So this funds a variety of things, but as a crisis response team that will be able to go out and support staff after a critical incident that occurs on their caseload or in their office or in their region, sort of hodgepodge this together, and staff have volunteered for that. This will add some additional staffing to be able to dedicate staff to be part of that crisis response, as well as contract out mental health support for staff who experience those really, they have, I say often, the hardest job in state government, out on the front lines doing the work they do every day, and really trying to increase the ways we support them, especially in light of the secondary trauma that they experience in their day-to-day life. And so building some capacity to do that. I anticipate more in this space, as well as just workforce retention. And like I noted, the workload study will yield probably significant asks as far as sort of caseload ratios and staffing. Also included in this deck for context that you will get are investments. They are green in other agency budgets, but that impact us, our clients, our services. I do want to highlight, I'm not going to go through all these. I do want to highlight the facility at Lake Burien. As some folks may know, DCYF rents a cottage at Lake Burien for one of our leased facilities, really looking at better options for young people who are experiencing placement exceptions. That entire property became available for lease, and DSHS was actually able to secure a lease with Multicare on that property. And jointly, we were able, in partnership with Healthcare Authority, the three agencies were able to successfully see some investment in the operating budget this year for DDA to use one of the three cottages. We will maintain one for our leased facility that DCYF will continue to staff and run. And DSHS, DDA will stand up a new service option, a new placement option for young people that are 13 to 18 youth that have sort of co-occurring have an IDD, DD, or autism sort of underlying diagnosis with a behavioral health layered on top of that, or mental health. These are often young people who are boarded in hospitals. This is not a problem you have not heard of. I am not telling you anything that you don't know, or sent out of state, or if they do end up in the dependency system, often the population that does experience placement exception. So this is a new option in the service array when we think about temporary, transitional, but residential placements for young people and youth who are experiencing really profound and complex needs. And really, we're hearing a lot from families who are saying, I just need another option. I need support to help my young person stabilize, ideally with the goal of transitioning them back to their community or their living environment. But there was sort of a prime moment in December when this property became available. It was a previous youth CLIP facility, and so designed for youth, meet some of those sort of environmental and structural requirements. And so pleased to see DSHS be able to lead into that, worked in partnership with them, and pleased to see this funding to sort of bring this new option online. Lots more to come as we're sort of designing and building in partnership with DSHS DDA, but really excited to be able to bring on this element. I will note 1 cottage, 12 youth is the goal in the first year, so that'll be fiscal year 25. So I think by design, starting small, learning, growing slow. This is something new. Our state has not done this, but excited to bring this resource online. And with that, I'm going to pause there, and I'm going to be all done sharing my screen if I can remember how to use Zoom. There we are. And see if, with 1 minute left, if there are any questions.
Allison, I did have a question, and it's more about, I do believe Senator Banky did a bill related to collecting data on child well-being, as well as collecting information that's looks at parents who are incarcerated who have children in the dependency system. And I think as we think about our work as a board, that is something that will hopefully give us some metrics to look at. One of the things we were trying to figure out is how do we know if we just collect data but are not really looking at outcomes? And so those things are coming, and I'm just wondering kind of if there's anything else you could share about that or any thoughts about that, but just wanted to bring that to light because I think that's information that could be helpful to us as an oversight board.
I would agree. That is 6068, the Dependency Outcomes Reporting Bill. And actually the lead agency is the Administrative Office of the Courts. Obviously, we have a strong role there. And it really helps us shift and think about what are the child well-being metrics and outcomes we should be looking at, not just things like timeliness. Timeliness matters. Children should not linger in systems forever. But also what are the well-being outcomes we should look at? And so excited to be in partnership with AOC in that conversation to sort of identify what are some metrics, and then spoiler alert, we'll likely come back to you all in the legislative arena with what those should be, and happy to keep this this conversation open in partnership with AOC through the board. I think that's a great connection and flag, Senator Wilson.
Thanks. I just think there's so much cross-system sector, cross-agency work, and oftentimes it's helpful to help us formulate and frame kind of what we're looking at and who we're looking at. So really appreciate that. Anyone have any questions for Allison? There's a bit of work to do. I guess the only thing I would say for myself when 6109 around children and family services, it was critically important to me that we didn't just look at removing children or the definition there, but we also thought about how we're going to wrap those services and supports around families that have not really been there. We've set up an expectation, but we've never really set up the resource to allow folks to be able to do oftentimes what it is we expect or ask them of. And so in my own mind, wasn't willing to do a bill that only dealt with removal unless it also included some of the very solutions we know should be there. And so really want to, thank Allison and the department, as well as Rep. Sen and a lot of our folks around the table. And I will say, Danielle, the group and the union had a huge role in helping us in conversation around definitions and around how the impact of the work and how it would impact, and the issues around the inequities in power oftentimes that individuals feel when they're walking into the court system, and really helping, I know, me understand more around all the spaces and places in the process where we need to impact and can potentially provide service for families, you know, not just at the end, but all those places along the way. So just really want to put that out there, because it's been as Allison said, a huge body of work, and probably one of the most difficult that I know that I've worked on myself, and trying to figure out how we are not necessarily equating keeping families together with children dying. And the fact is, one is a public health crisis, and we also want to make sure we're unifying families where it's safe, where it's possible, and where we can provide, you know, the service that young people and families need. So anyway, just really want to thank you for the hard work y'all do every single day. All right, Dr. Levy, I think am I passing it over to you? I do believe.
You are passing it. Thank you very much, Allison. We're going to transition into our public comment period. So to begin, I'm going to read a statement by the Oversight Board. The DCYF Oversight Board is governed by state law. Per state law, the Oversight Board's authority includes monitoring DCYF's achievement of 8 outcome measures listed in DCYF's founding legislation, monitoring DCYF's compliance with applicable laws and policies pertaining to early learning, juvenile rehabilitation, juvenile justice, and child and family services, general oversight of DCYF's performance and policies, and providing advice and input to DCYF, the legislature, and the governor. The Oversight Board does not have the authority to inquire into, direct, or change DCYF decisions in individual cases. For those wishing to provide public comment to the board, we would like to remind you that the board is subject to the Open Meetings Act, which means that our meetings are open to the public and anyone can attend as an observer. Our meetings are recorded and posted on the Oversight Board's website and will be broadcast on TVW. We wish to inform everyone in the attendance of this fact as an act of respect and to support the individuals who may have a sensitive story that they wish to share or wish to express individual case details in this setting. The Oversight Board may use any information brought to the board's attention as it carries out its role of general oversight and monitoring of DCYF. If individuals do not wish to provide public comment in an open meeting, individuals may contact the DCYF Oversight Board staff and get connected to the board's co-chairs. We are also more than happy to connect you with the Office of Family and Children's Ombuds if you wish to file a complaint about a specific DCYF action or failure. Their website is www.ofco.wa.gov. And having said that, then we had 2 written public comments that were all sent out to the board ahead of time. So hopefully everybody's had a chance to look through those. And then today we have 2 individuals who have signed up for the live public comment. I don't think we have huge time issues today since there's only 2 of you, but we do generally like to keep your comments to around 3 minutes or so. So the first person is Tates Nunez. And I believe Nicholas is going to unmute you, and so you can speak to the board.
Yes, can you hear me?
Yes, we can. Thank you.
Thank you. Dear members of the Washington State Department of Children, Youth, and Families Oversight Board Committee, thank you for affording me the opportunity to address you all with the utmost urgency concerning crucial matters regarding our ongoing plea for a transparent and impartial review of Oakley Carlson's Washington DCYF case under Governor Inslee's administration. On Thursday, February 29th of this year, a gathering convened at the Capitol in Olympia, Washington, uniting families of foster parents, advocates, and sadly, many who have tragically suffered the loss of children to abuse, drug abuse, and neglect. The purpose of this assembly was to advocate for legislative reforms concerning the well-being of Washington state children affected by HB 1227, known as the Keeping Families Together Act. This event, which was hosted by Ashley Bartell, the aunt of Hazel Homan, whose life was cut short by a tragic incident involving her father's girlfriend while under the supervision of Washington State Department of Children, Youth, and Families, aimed to bring attention to the critical issues surrounding child safety and accountability. A poignant symbol of remembrance and awareness, organizers adorned the Capitol steps with 85 pairs of shoes, representing the 85 children who lost their lives under the care of Washington DCYF in 2022 alone. In 2022 alone. The gathering sought to compel lawmakers to address the inherent risks posed by HB 1227 and to ensure greater protection for vulnerable children across the state. Acknowledging the importance of legislative engagement, we want to express our gratitude to the lawmakers who took time out of their day to engage with those attendees, demonstrating their commitment to safeguarding the children of Washington. With this in mind, I am compelled to address a matter of utmost importance and the main purpose for my attendance today. I trust many among you are familiar with the distressing story of Oakley Carlson, a 5-year-old girl from Oakville, Washington, whose disappearance remains shrouded in mystery. Prior to her unsettling disappearance, Oakley had found solace in the loving embrace of her foster parents, Jamie Jo and Eric Hiles, for nearly 3 years. However, a sudden mandate from DCYF abruptly severed this familiar bond, compelling Oakley's return to her biological parents, whose tumultuous history of substance abuse and endangerment was a matter of record. The subsequent legal proceedings surrounding Oakley's biological parents paint a harrowing portrait of systematic failure. While one parent faces a truncated sentence, the other remains free, leaving Oakley's fate hanging precariously in the balance. These grim circumstances underscore the urgent need for a paradigm shift in our approach to child welfare. While the best interests of the child are unequivocally prioritized over bureaucratic agendas. Based on the verified timeline provided in my email, it is evident that Washington DCYF closed the case without conducting a physical assessment of Oakley's well-being in March of 2021. Consequently, Washington DCYF cannot definitively ascertain whether Oakley was missing at the time of case closure. This raises concerns about the agency's adherence to its duty of ensuring the safety of vulnerable children. Why did the state agency responsible for safeguarding children fail to verify the child's safety before concluding an open investigation? The facts are straightforward. Washington DCYF failed Oakley Carlson. Therefore, I beseech you to join us in petitioning Governor Inslee for the immediate instigation of an impartial and transparent external review of Oakley Carlson's case. It is imperative that such an inquiry be conducted by an impartial entity to ensure a comprehensive and equitable assessment, thereby upholding the principles of justice and accountability. You can access the petition mentioned as well as the timeline detailing Oakley Carlson's case and the OFCO report in my submitted email. Thank you all for your unwavering support and attention to these pressing matters.
Thank you very much for your comment today and your willingness to come and speak with us. Our second public comment comes from Shayna Richard.
Can you hear me?
Yes, we can hear you.
Thank you so much. Thank you to the Oversight Board Committee today. For the last 2 years, Light the Way Missing Persons Advocacy Project has organized a weekly phone call and email writing campaign to Governor Inslee on behalf of missing child Oakley Carlson, requesting that he conduct an immediate secondary independent agency review of Oakley's Washington DCYF case. This past fall, Governor Inslee eventually responded and stated that the Office of Family and Children's Ombudsman found that DCYF's conduct and actions were consistent with court orders, state and federal laws, and agency policies. My office has a high degree of confidence in both the thoroughness and impartiality of the OFCO's investigation and finding regarding DCYF's conduct and its service delivery to Oakley and her family. His response felt as if he were ignoring our concerns regarding Patrick Dowd's lack of transparency when interviewing Jamie Jo Hiles, Oakley's foster mom, and our verified timeline, which shows Washington DCYF's disregard for the multiple phone calls and emails made to social worker Angela Freese regarding Oakley's safety. The facts are simple. Washington DCYF failed Oakley Carlson, and we have created a petition in support of seeking answers for Oakley by requesting that Governor Inslee conduct an immediate secondary independent agency review of Oakley Carlson's DCYF case. I would like to read that petition today. Oakley Carlson is a 7-year-old girl from Oakville, Washington, whose last known credible sighting was on February 10th, 2021. Sadly, Oakley Carlson was not discovered missing until 10 months later on December 6, 2021. In the month prior, there had been a fire at her home, and a school principal became concerned about Oakley's safety after not seeing her when bringing the family donated supplies. During the welfare check for Oakley, her biological parents, Jordan Bowers and Andrew Carlson, were taken into custody and refused to give any credible information about Oakley's whereabouts. Bowers and Carlson were initially charged with manslaughter in the first degree. However, the charges were later dismissed when there was not enough evidence to move forward. They were then charged and convicted of 2 counts of endangerment with a controlled substance for exposing Oakley's siblings to methamphetamine. On March 14, 2022, Carlson pleaded guilty to 2 counts of endangerment. He was sentenced to the maximum 12 months in jail, but was released on August 3, 2022, after serving less than 8 months. On August 22, 2022, Bowers pleaded guilty to 2 counts of endangerment and was sentenced to 20 months in prison. Bowers was released from prison on January 15, 2023, but was immediately taken into custody and booked on 3 counts of identity theft in the first degree and 1 count of identity theft in the second degree, in a case unrelated to Oakley. In July 2023, she took a plea deal for the identity theft charges and was sentenced to 43 months in prison. Although neither of these cases are related to Oakley, Bowers and Carlson remain suspects in her disappearance and refuse to cooperate with law enforcement. Oakley spent from 7 months to almost 3 years old in foster care with her loving foster parents, Jamie Jo and Eric Hiles. They provided a safe and happy home where Oakley thrived. The Hiles, along with community members, raised concern about her safety to Washington DCYF many times while she was in their care and even after Oakley was returned to her biological parents. The Hiles feel their concerns were not taken seriously and were ignored by social worker Angela Freese and her supervisor, Catherine Eddy. Washington DCYF failed Oakley, and this petition is in support of seeking answers for Oakley by requesting an immediate secondary independent agency review of Oakley's Washington DCYF case. According to police reports and court documents, while in Bowers and Carlson's care, Oakley was starved, physically abused, and locked in a cell as a form of punishment for bad behavior. Court documents state that from 2013 to 2021, DCYF received 11 intake phone calls about the Bowers-Carlson family regarding domestic violence, physical abuse, parental drug use, and medical neglect. Only 8 of those calls were screened in and investigated. In January 2021, Washington DCYF received a call that Oakley had scratches and bruising on her face. Washington DCYF opened an investigation, but both Bowers and Carlson refused to cooperate. Yet Oakley remained in their care. In November 2021, Washington DCYF received 3 separate phone calls in 2 days about the family. Specifically, there had been a fire at the family home. Bowers and Carlson did not call emergency services, and the family continued to reside in the home despite an insurance agent advising them it was unsafe to do so. These 3 calls were screened out and ignored. There is no excuse for this type of abuse that Oakley suffered and the blatant disregard for her safety by Washington DCYF and the social workers involved in her case. Court documents clearly state that DCYF went to investigate the incident in January 2021, but the biological parents refused to cooperate, yet she remained in their care. Washington DCYF then closed that case in March 21, and law enforcement stated that Oakley's last known credible sighting was on February 10th, 2021. Following that information, we can conclude that Washington DCYF closed the case without ever physically seeing Oakley in March of 2021. Washington DCYF cannot confirm that when that case was closed in March 2021, that Oakley was or was not missing at that time. Why would a state agency deemed with the job of protecting the most vulnerable children not verify that a child was safe before closing an open investigation? In May of 22, after much public pressure, Governor Inslee requested an internal investigation of Oakley's case. Patrick Dowd, director of OFCO, handled the investigation and stated, "We found that the department's actions and conduct in this case were consistent with laws, policies, and court orders." Mr. Dowd stated that parent-child visits are critical to a successful family reunion, and that reunification planning should not only focus on a parent's successful compliance with services, but should also address parent-child bonding and attachment issues. Due to the privacy laws, the investigation details remain private, and little information of this report was shared. By signing this petition, I feel as though the investigation done by OFCO lacks impartiality and transparency, and I am asking Governor Inslee to call for an immediate secondary independent agency review of Oakley's DCYF case. This petition was started 1 week ago on March 14th, and at this time, a half hour ago, it has 1,081 signatures and continues to grow. Thank you for your time.
Thank you so much, Shana, for coming and giving us that public comment today. We appreciate it. All right, now I'm going to send it back over to Senator Wilson.
Thanks so much, Diane. Just wanted to talk a little bit about what we have been talking about with staff around kind of future planning meetings and kind of discussions we've had, especially around the topics we chatted about at our last meeting that may be of interest to do a little bit more of a deeper dive into. And so as kind of thinking forward, potentially, you know, for me, just thinking about today, what transpired, it seems as if number one is to get the subcommittee going and to actually create the process that we talked about, and then move into the process, I believe, of it would call for one more meeting from what I understand as a board for us to be able to take action, and then hire an executive director. And after that, I would hope that we're at a place where it would be an appropriate time to do some kind of a board retreat, and perhaps also a time to do a little bit of a review over the last 5 years, because this is a 5-year time period since the Oversight Board has been created, and also do some deep dives into the kind of the organizational changes and the things that have happened within DCYF, again, that have come up at our past meetings. And some of those things are the JA to 25, today, what that looks like. And I know specifically, as we think about the older adolescents and the young adults we're serving, it changes the nature and the kinds of programming and supports we need to, and DCYF needs to be considering. Heard today still questions around adolescent services and programs and what that looks like and how those things are being operationalized, if you will, from that level. We've talked about prevention and also a lot around foster parent supports. That continues to be something to lift and to have conversations around. So my hope is, as we think forward, that kind of would give us a place as a board to launch, if you will, our next iteration with a new director. And for me, and I know others being a new board member, kind of a reset or a relook and kind of where we need to move from there. And Diane, wondering if you've got other thoughts or around that as well.
No, I think you pretty much summed it up, what we've been thinking about. You have the list in the agenda of the topics that kind of rose to the top at our last meeting from all of you about what you were interested in hearing about. And so that kind of reflects trying to put it in a little bit of a list of priorities. I think, and then I think, you know, obviously we can't do an awful lot until we get the executive director post filled. So that's kind of critical, but I know we also have Nicholas, who's going to give us a lot of support, so he will help us stay in line. And I guess the only other thing, in thinking about ahead is also, I think one of the things to think about with this idea of a retreat is not just to sort of get a little bit clearer about our scope and where we want to kind of put our energies and focus, but also whether there needs to be any changes, even legislative changes to the way our board is structured going forward. And so that is something I want to just have you guys kind of think about a little bit as we go forward and look at maybe having that retreat, hopefully this summer sometime.
I think related to that, we also, and I don't know how impactful it will be, but with the gubernatorial change, there may be also, because this does sit in the governor's office, kind of whether that impacts also as we think forward on legislation or anything else. So it would be great to have that conversation, and we're to be ready for that. When a change does come in leadership, then we as a board have already kind of been thinking forward about the body of our work and such. So, and that would be then ready if we wanted to do something for the upcoming session. So time frame wise, that sounds good to me.
Do you guys have any impact on what we sort of presented? Any thoughts?
I saw a thumb from Rep. Sen.
I think, given the fact that we have asked the department a couple of times about adolescent services, that probably should be high on our agenda of issues to address.
It definitely is.
Yeah. Senator Warnick, I'm sorry, my dog started to bark, so I suddenly had to mute myself.
Okay, I'm used to barking dogs, but I agree with the list of items that we should discuss at a retreat type of situation. My summer is filling up incredibly fast, so it would be good to know when and where a retreat might be planned. So I do think we need to be looking forward to what's next on the board's agenda and what we can do to help our children and our families. So the earlier the better as far as a retreat would be helpful for my planning anyway.
Thanks. I duly noted. Think first and foremost is getting somebody in the leadership space.
Right.
Because we could retreat all we want, but it's really going to be creating that conversation. So yeah, why we need to kind of get on board with a timeline and figure out those next steps. And we only have 30 days or a little bit more before we lose our current ED. So hopefully we can get some things in order before that happens.
And maybe fall would be a good time. So
yeah, and I don't know if it would make some sense to maybe put a hold on a couple days that work for you, you as the whole board, going forward, maybe one towards the end of the summer and one in the fall, and then we can sort of potentially have those available in the hopes that by then we should have our executive director, I would hope. So if not, we could always cancel it.
That sounds like a kind of a good plan forward, because I do know, as we all know, our calendars fill up really quickly. So is that something staff can help with us, just to have a couple of hold dates? Awesome. Other thoughts that individuals have about kind of thinking forward, or anything that was brought up today that's kind of still a loose end? Lois.
Thank you. Well, a couple of things. Number one, I'm looking forward to just seeing how we reshape the board. So excited about that. I have emailed our two co-chairs. So it's good to see what's being brought up. I also want I hope I'm not stealing the co-chair's thunder, but I want to thank Krista, everything that she has done in her role as ED. I just realized that this will be your last meeting. So I just wanted to publicly let you know how much I appreciate your leadership and the amount of professionalism as well as empathy toward community members in what can be difficult conversations that you have shown. So I just wanted to show you and thank you for your leadership again.
Thank you, Lois.
Lois.
Oh, sorry, I forget. We have our microphone set up and I gave you feedback again, but thank you, Lois. I appreciate that.
It's
This,
echoed
you
many
know,
of us.
I think go ahead. Sorry, Rep. Sen, go for it.
No, I was just gonna say it's echoed by many of us. Certainly knew Krista before she was the executive director, just through the selection process. And I don't think we could have hired somebody better who was more focused on the data points, on really setting up a structure that helped guide us through all of these twists and turns in a way that was neutral and effective and really got this board going. And as Lois said, leading with grace and humility and I think true impartiality, always really listening to our questions, responding to the board as her North Star of who, I won't say who she answers to, but like who she was taking guidance from, and really being just so responsive and leading in, because we were all kind of, 12 blind mice, right? Moving forward, trying to create this structure. And I don't think we would have moved forward in any tangible or cohesive way if it had not been for Krista. So I too thank you so much for your service, and it's been a pleasure working with you.
Thank you so much. Yes, it's been a wonderful 5 years, and I would just hope for the success for the board moving forward too. I think all the points made today about 5-year mark in, new administration coming in, and just it's a good time and a new refresh. So I appreciate getting to know all of you for several years and some of you more recently. And I will hopefully be back in some form or fashion after a little while, just stepping away to take care of family for a bit. So hope to see everyone in some form in the future.
I will have to say I probably have been the one that's met you have known you the least amount of time, but I would say to Krista, so like, where do you work? And like, she's an office of really an office of 2, right? And it's like, it took me, to do what she does and to have the impact she's had and to herd an amoeba is what I would consider sometimes oversight boards and commissions and such. It takes a special person to be able to kind of corral all kinds of folks to get what you need when you need it from those people that you need it from. And you've been able to do all of those things and answer questions that, I've not ever been able to find an answer for. So just again, really appreciate it. And I'm thankful for all you've done, and also that you have an opportunity to step away. And hopefully, while you do that to take care of others, that you're going to take care of yourself, and that you'll spend some time with your feet up and maybe a cup of tea or something, and not have to worry about other people's problems, but be able to enjoy some time and some downtime. So really want to just, again, like everyone else, publicly thank you for, all you've done for kids and families, because it's one of those positions people don't even really know it exists. And then, the breadth and the depth of what you've done has been remarkable. So thank you.
Thank you, Senator Wilson.
Yeah.
Well, and I have to say, I was a little mad at Krista because right after I got elected to be co-chair, she tells us she's going. I'm like, no, you can't leave us. But truly, I mean, it is for obviously the best reasons to take care of your family. And I would just say that I think that you're exceptionally knowledgeable, and the ability to articulate what we need to do and how to get us to where we need to go has been really tremendous. So I really appreciate your insight, and I'm glad that you gave us a little bit of timeline so that we can get, we've been putting some things together before you do leave. And I know Nicholas is going to help us when you're not there. So I appreciate that. And yeah, I would have to say I've been very impressed by just how much you do. That doesn't always show through on just these meetings, but you're doing so much behind the scenes. That's so important. So thank you so much, Krista.
Thank you, Diane. And yes, I do want to acknowledge Nicholas is definitely the one that keeps things running here. So I might be the face of it, but we would be nothing without Nicholas. So you guys are all fortunate to keep him on, and he'll help keep everything moving forward. Thank you all.
Yeah. Well, we have come to the end of our agenda, and there is absolutely nothing worse than sticking around when the work's been done. And it's not a gift of time, because when the work is complete, that means that there's opportunity to have some to do other things, because I know people will fill whatever free time they have with another body of work. So I would just say, for the good of the order, if there's anything else, anything board members would like to share or say, give it that 3-second wait time. And then just again, say thank you. And I know the subcommittee will gather, and then we'll be hearing back from them once they've got a process in place for all of us to look at and to vote yay on. And then we will move forward, and assuming we'll get something in the coming weeks. So without further ado, thanks so much, everyone. Have a good afternoon.
Bye, everyone. Thanks.
Take care. Thank you.
Bye.
Bye.